constriction. They laugh a lot. They get so much of anger. There's so much of stress due to any workload. They get this. So there are certain types of bronchial asthma also. That is like adult onset. So adult onset is people will come and say, ma'am, I started getting this after the age of 18. Up till my teens, I was all right. After the age of 18, I started getting. Or it is a pediatric age group before 5. So before 5, we can have a strong feel that they have got a family history of bronchial asthma, and they will have a presiding history of atopic dermatitis. Next is exercise induced, which leads to bronchospasm, occupational, or disease related to COPD condition, that is chronic obstructive pulmonary diseases. So we all know that when the disease related to COPD is due to emphysema or due to or due to any other obstructive disease condition. Now, what are the symptoms? Basically, a person coming to a room, they'll say, like, I hear sound in my chest. I hear a whistling sound in my chest. I hear a twinkling sound in my chest. So, like, it is, we know how it is possible due to bronchospasm. The air is not going inside properly during inhalation. It is not getting circulated in the alveoli properly. And when they want to exhale it out, when they want to throw the air out, the alveoli is not able to close properly, because now this alveoli is loaded with expectation. The goblet cells have loaded down with lot of mucus. So they use the abdominal muscle, they use the extra respiratory muscle, and they push the air out. So when they push it, the air squeezes through the blockage, the air squeezes through the obstruction. So when it goes back, the whistling sound here, and cough, especially in the morning or during time. They usually say early morning, 3 o'clock, 4 o'clock, I got disturbed in my bed. So all this leads to chest tightness because of the constriction. Shortness of breath is a very next thing. So what is the shortness of breath? Dyspnea. We know there are 5 grades of dyspnea. So now, when can we say it is an asthmatic attack? Simply, if a person come and say, I got an asthmatic attack, means we can't tell it is an asthmatic attack. We have to know certain things. When those kind of history or examination or tests are being confirmed, only we can say they got an asthmatic attack. So now, what is the history? So you ask, the patient comes, he tells, I got difficulty in breathing, I have got a tightness of chest in my lung. So you can ask, like, what you did, what are your symptoms, how did it start, when did it start, why it started, how it was the symptom progressing, how many days you had the symptoms, and did you take any other medication? So most of the people, when you say the constriction of the chest, that they're not able to breathe, they run for the modern medicine. And you have to ask them what sort of treatment. And treatment will be usually steroid or bronchodilators. And the next thing you have to ask is about the parents, who all in the family have got the symptom. And the next is how many, if they got children, how the children are affected. And history of allergies. Allergies for either for food or allergy either for the surroundings or either for any other circumstances. So certain people in classrooms, we can see, like, when you ask certain questions, when it is a tough time, they want to go for a viva, immediately they go for constriction and they started panicking. You see the lung is filled up with, that is like anxiety. They due to the stress leads to the vasoconstriction. Or they have got a history of eczema. Either the person has got eczema or the people in the family has got eczema. Next is the renal problem, whether they have got any history related to the kidney. Now, what is the investigations? So now, investigation, basically when the person says, I got breathlessness in breathing or tightness of chest, first we give medicine, second, the third time we say, okay, we have a chest x-ray. So chest x-ray will show congestion of the chest. We see the patches, congestion of the chest. Blood test, when we do, we see the monophils, we see the eosinophils due to allergic or non-allergic, we see the neutrophils, and skin we see patch test. So patch test in the skin, we see for what are the allergies they are for. Either they are allergic to animals, whether they are allergic to the food, or they are allergic to the dust, or they are allergic to anything else in the house. So the last one is the spirometry. So spirometry is an important test which helps us to find out the tidal volume. So how much is the lung capacity? How much the air goes into the lung and comes out? How much the person can hold the breath inside him? How much the volume of air is inside him? So as we give treatment, we can confirm with the spirometry like how much they are better with this. So how they are improving with this. So when a person goes for an bronchial asthma, he won't cooperate with the spirometry because they'll close their nose, they tell them to breathe in the mouth, they'll tell them to hold the breath, he will never cooperate. So the next one is, what is the issue of concern? So issue of concern, you can relate it to WHO also. They also saw that why it is the issue of concern. Because they saw like, when they did a lot of studies, they have found out that in a population, maximum people have got at least one attack of bronchial asthma. And in that, half of the population has got a family history of either bronchial asthma itself, or they have got an exposure to an allergen that has got a bronchial asthma. So now anybody who has got this, they go for inhaler. So usually they tell it as a rescue inhaler. What is this rescue inhaler means? If you ask a chronic asthma patient, he'll tell, I need an inhaler in my handbag, I need in my car, I will need in my bed. Anywhere, if I see the inhaler, I'm feeling happy. Because that that panic, whatever they're getting is worse than the attack. So when they see that they don't have an inhaler, they immediately go for anxiety and panic. That is one basic rule that every bronchial asthma person has got. So once you treat them also, when you say that, okay, you can get rid of the inhaler, also they'll start telling you, ma'am, can I have that at least one puff a day? They'll ask that question. Because that much fear the bronchial asthma people have. So when it becomes severe, sometimes we call it a status asthmaticus. When it becomes severe, they go for cyanosis. They go for bluish fingernails, they go for bluish lips, they go for gray or whitish lips and gums. Chest pain, they feel the pressure in chest because the air is trapped inside and it is not coming out. So they feel the chest pain inside them. And they'll have the cough, the tickling sensation in the throat. They start coughing and they won't stop. So when they cough, they feel better, like they throw out the sputum. So a lot of people say, ma'am, when I cough and when I get the sputum inside my mouth, I can see small ball of sputum. So this small ball would have blocked somewhere on bronchial, and when they cough, it comes out quite easily. Or they'll say, ma'am, when I coughed out, a long thread of sputum has come. So that also is the cast that blocks his airway. So when they cough, the cough reflex removes it. The next is difficulty in talking because they cannot inhale or exhale properly. When it is more severe, they are pale, they sweat a lot, they go for rapid and hurried breathing or very difficult breathing. So with all this, when a person comes with the knowledge of this bronchial asthma, as an IRES department, as a homeopath, we do a little bit of favor for these people. We can reduce the inhaler usage. We can reduce them from, we can help them from reducing the usage of steroids. So here are my two cases. In that, this is the first case I would like to present. These are the recent cases I have got. And I have given a short glimpse of these cases only. I have not gone in detailed pattern of the case taking because I think most of us know that homeopathic case taking, we give more importance to physical journals, mental journals. We treat the, we said it's not a patient, we treat him as a person. This person has got this disease. We call it like this person, a male of 27 years has got a symptom of bronchial asthma. So we treat the person inside. We treat the person who has got the disease. We call it as individualization. So here the case was reported on 16/9/2020, a male of 27 years age, occupation IT professional. So I would like to add a point to this IT professional because this person, he is working in IT field for the past 5 years and he's used to sit in one place and his room in his office is fully AC and he never goes out. He literally has a sedentary life. And during our lockdown period also, he had set the same setup in his home also. Fully AC, he never comes out because as such, the pandemic also, they had insisted that he also never came out. So like when this complaint became little severe, he came to us and he told difficulty in breathing since 3 years. So since 3 years, so we asked like only since 3 years, but now you are better. So ma'am, this is the history I got since 3 years, but now I have got the increase in complaint. So he says the difficulty in breathing since 3 years, dry cough, it can be expectation since 3 years. These are his presenting complaints. So the history of presenting complaints was he had grade 2 dyspnea. So grade 2 dyspnea is like he tells that when my friends and myself go out for a walk or we go for a cricket or something, I am not able to do as much as that of my friends. I become little slower. And when this dyspnea comes, I start sweating a lot with the cold sweat. And he tells like as soon as he lies down, we get tightness of the chest and pain in the epigastric region. So pain in the epigastric region, when we ask like why this pain is there in the epigastric region, he tells that I sit straight and I breathe from my abdomen, I breathe. Because I feel my chest muscles are not cooperating with me because all the muscles are tight, I breathe with the abdomen. So we know that his diaphragm is working so hard to give that upper epigastric pain. So tightness of chest at night. So orthopnea is present. He never lies down properly. When he lies down, he gets dyspneic attack. He sits, he lies down, he walks, he goes this way, he's so restless. So he tells that I get this set of symptoms once in a month. So once in a month, at least 7 to 9 days, he suffers to the maximum. Okay, so suffers to the maximum, and we asked what is that? This tightness of chest, this dry tickling of morning, when I cough, I spit out the sputums. Now what is the color of the sputum? Sputum is scanty. Sometimes it is yellow in color morning. So like what are the medications you are taking? So I take inhaler. During my complaints, I take 4 times a day. And when there are no complaints, another 20 days, I take once a day. Early morning, I take 1 puff. If I don't take the puff, I feel it very difficult to carry my day. So with this, as each and every visit, he might have an infectious type or he might have just a bronchospasm type. Depending on that, his medication varies, whether it is a steroid or whether it's an antibacterial therapy or whatever it is. And family history, his grandmother had the similar complaints. So my screen is sir?
Karina, we can see your screen.
Yeah. Just okay. Okay, sir. Next slide has come.
Yeah.
So, like after taking the first half of case taking, now we go to the personal details. So his childhood was okay. He has gone and brought up better things. His schooling was fine. He did his college very well. He had a good interview. He got a placement, and he's happy with all that. His appetite is also good. He tells like whatever the complaints, I eat well. But nowadays, like during the complaints, my appetite comes down. He says, and thirst is reduced. Thirst is reduced during the complaint. It takes only few sips of water. And overall, we asked like how is the thirst? Overall, also listless. And sleep is disturbed. Now, disturbed, here he mentions about 2 things. One is due to the complaints. One is due to the complaints. That is because he's very restless. He's not able to breathe properly. Or because of the anxiety he gets. He's not able to sleep properly. So, disturbed sleep, because any position he takes, he doesn't get the sleep properly. And he likes fatty food, but fatty food always aggravates him. So because he takes fatty food, he has got a pain in the upper epigastric region and he has got a regurgitation. He burps very often. His upper part of the chest starts burning. So he thinks that he has got a GRD. Oh, I got some GRD or what. Whenever he bends down, the acid comes into his mouth and all that. And he's restless. He cannot sit in one place. And this restlessness is very severe during his complaint. So food is aggravation by cold food, acidic food, and dampness. Whenever rains, you might feel better, but after rain, he is not at all better. So that is his physical general. And mental general, like it is like he's anxious about the disease. From the time he came and said, his only question is, will it be all right? I have been taking treatment for 3 months. Will your medicine cure me? Will each and every episode I'll suffer like this? What will happen? What will happen to my children? If I marry, what will happen to my family? Everything. He thinks about his family. He thinks about this disease. He keeps on googling in the net and all that. And as we tell, at night when he lies down also, even when he has got no symptoms also, he repeatedly thinks about his future. And because of that, he's now weak memory, means he's sluggish in thinking. And one more thing is he wants everything to be ordered. He planned his life will be like, I'll go to job, It will be like this. I can earn, I can have a house, I'll be like this. So many things he thought. But because of this complaint, he was not able to do as it is. And in the workplace also, he never likes anybody coming and sitting in his chair, touching his work things, all that. So with all this, we go to the third part of the case taking, examination. So chest, we do our auscultation and we see these sound heard all over the lung fields. So either it is monophonic or it is polyphonic. Usually in bronchial asthma, we all know that it is polyphonic in nature. So, and while hearing to the breath sound, what is the breath sound? We see that he has got a bronchial breathing. And the vesicular breathing has stopped because for 3 years of history, all his bronchioles are dilated, all his breathing has become very harsh. So he has got a bronchial breathing. On examination of nose, he has got a mild congestion and he's got a hypertrophy. And we can see inflammation in the nose also. And on general physical examination, he's pale. He's pale because thinking, anxiousness, he doesn't sleep well, and he looks pale, and respiratory rate, it is 21 per minute. So now, in a homeopathic part, we have got the totality of symptoms report. So I have taken all these symptoms because mind anxious about future, very restless, moving around, wants to be perfect and organized, thirst decrease, cold food disagrees, epigastric pain with acidic and asthma, difficulty in breathing when thinking about the complaint. With all this, when we put a totality, and when we repertorize in a 10th repertory, the drug of choice we get is arsenic. So arsenic is a drug which has got majority of its symptoms. It's a drug which has got majority of its symptoms. So it is aggravation by cold. The patient is very restless. The patient has got tightness of chest. He gets early morning aggravation. He has got a mild expectoration. He's very anxious. He doesn't sleep well and all that. So, like with all this totality and based on the 10th repertorial totality, I have given arsenic album 201 dose. So this one dose is given in sugar of milk and 4 pills have been given in that. And it's I told him to take the night when he came. So followed by placebo every night and morning in the empty stomach was given. That placebo giving every night and morning is to satisfy the patient because when they are into the modern medicine, they are used to take a lot of medicine. They take a tablet, they take syrup, they take inhalers and all that. So when we give one dose, they are not happy with that because homeopathy, we go for simple dose, single dose, all those kind of things, and they are not satisfied with that. So, and he was advised to have a regular breathing exercise because he does certain yoga practices. So it was like, okay, you do some breathing exercise in that so that your nose, your lung, you increase the volume of the lung and all that. And as a general management, he was advised to take a cup of warm water or milk before going to bed. This is just to warm up his mind or his bed to have a good sleep for him. So we asked the patient to come after a week. So he tells that dyspnea has improved. So we just can't say like the patient coming and tell dyspnea has improved. So now on examination, we can see that bronchial breath sound has reduced. And wheeze, which was heard all over the lung field, now it is less and it is more towards the middle and lower part of the lung field itself. So now we asked like, now how do you use your inhaler? How much time you use? Because during the complaints, you take 4 times a day. And he told, I have reduced the use of the inhaler. And because we say about the totality, we say we do the repertorization. When we gave medicine for the dyspnea, simultaneously, his burning in chest was little better. And we know sleep will be naturally better because his physical complaints is getting down and his sleep pattern has improved. He doesn't get disturbed during the night. So again, one more dose was given and similar way with the placebo for another 1 week. And after 7 days, he was asked to come. And this time when he came, he was very happy. He was like, ma'am, I could sleep well. So this is the one. This is the anxiety, whatever he had is, of course, every time thinking about the disease, every time thinking about the future, every time what will happen, what will happen, what will happen. So he told, my sleep has improved and I sleep well, and now I use only 2 times a day. And we asked, like, do you have the habit of keeping? Yes, I need that in my hand, but I don't feel like using it. And digestion, chest burning has come down. So, like, he was given placebo, no more medication was given. He was given placebo for a month and he used the inhaler 2 times a day. Because, as said, for the past 3 years, he had got the habit of taking inhaler. So, immediately we were not able to reduce him from the usage of inhaler. So after 3 months, when he came back, he told, like, in these 3 months he got only 2 attacks, and he can tolerate with the less usage of he can tolerate with the less usage of inhaler. Also, like, after taking the homeopathic medicine, his intensity of the complaints were reduced. And, like, slowly, like, once he came after 4 months and after 6 months, he told, like, now he gets dyspnea only when he do a strenuous work, when he runs or when he is in a hurry. Only during that time he gets. But still, he uses that inhaler daily. So now for that we have planned and we gave him a counseling, like, okay, inhalers are good, but we have to reduce. But to bring him out of that, it may take some more time. So, but all his physical, his dyspneic attack, his tightness of the chest, his cough, all has come down. So this is a simple thing about Asthmicum album. They are, like, very anxious about their health. They are extremely concerned with order and security. They have got an obsessive compulsive disorder to be very neat and may feel desperate to control everything in their control. They get panic attack in the late night and in the early mornings. They feel exhausted, restless, like fidgeting, pacing, anxiously moving from place to place. This can be due to disease. This can be due to the mental restlessness. This can be even due to minute thing. This can be due to any change in their pattern. Those people usually will have digestive problem or asthma attack. Together they have, because Asticum album always will have asthmatic complaint triggered by digestive problem. So now case 2, it is a case of 2019, female, 39 years, housewife. She got, for the period of 11 years, she has got breathing difficulty. So modern medicine she takes for 10 years and now she's on steroid inhalers and tablets. She takes tablets regularly and inhaler is a must for her. And dyspnea was on grade 3. So grade 3 is like, she tells, like, I cannot go for even a few steps. After I go few steps, I have to sit and then I have to do it next. So she tells that I'm very weak. I feel very down. I'm very fatigued. And she's heavy also. She's like 86 kgs weight. She has got a dry tickling cough attack. So she coughs, and she becomes red in color. She says, my eyes, my cheeks all pains after I cough. And my abdomen also pains. But the more I cough, I spit very less. And during breathlessness, she says that she longs for fresh air and feels sleepy at night. That in first case, we see that he's not able to sleep. The second one, he says that she feels sleepy at night. And when she's disturbed at night, she tells of all weird things. Weird things like she's going to lose everything. She's going to jump from somewhere. So many weird things she starts getting in the sleep. And anything in the form of cold she takes, she catches cold easily. It can be like a fruit, citric fruits, or it can be anything related to buttermilk, or it can be anything. She starts getting the complaints. So as we have seen, it's a plethoric in nature. She's fat. Excessive sweat is there, apprehension of the future and her disease, likes eggs, dry, mouth is dry mostly at night. She tells like, I cough more and more, and I feel that I am dehydrated and I need water. So on examination, the chest wheeze was heard all over the chest and monophonic in nature, and external accessory muscles were used for breathing. And with all this apprehension or with all these kind of things, excesses with craving for eggs, with the thirst, or with the sleep pattern, everything, Calcarea carb, you know, the Calcarea carb is antisoric remedy. It's a great remedy that our master Hanuman has given to us. And this remedy suits to the person who is fat, flabby, everything. They drink a lot of milk, they like water, but when they take cold, it's nothing for them. They usually catch cold very easily. So one dose was given the next day morning, again in the powder dose only it was given, and then placebo was given morning and night. So review after a week, no much betterment was noticed. She told us, no, after taking this medicine, I don't have any change. I don't have any change in my breathlessness. I don't have any change in my cough. I don't have any change in my sleeping pattern or anything. But when asked like, how is your abdominal pain? You tell like any cough, you feel more of your pressure in the abdomen, or how is the tickling in the throat? The tickling has come down, but otherwise my breathlessness has not come down. Now she says like I'm in favor of that inhalers only. I like inhaler and all that. Then again we gave the same medicine, and then she came back after a week and she told, I'm better with my tiredness. Even though I have got this much dyspnea, my tiredness I'm feeling better. So after that, again we had given a placebo for a month, and when she came back, she told dyspnea is of grade 2. I can do my work, but still I'm better with my tiredness. Weakness was better with sleep improvement. And after so many 3 years or 2 years of treatment, she couldn't stop the tablet. She always says, I'm adherent to the tablet. Tablet is not there. No, I'm done with it. So slowly giving counseling and all that. Now she's reduced. And slowly, like when 2 months back when she came, she was told that she stopped taking the tablet also. But fear of losing the inhaler is present, but uses it very rarely, because we told her you have it in your bag, but you can use it in a less amount. And complaints after not a very frequent, in a month, 2-3 times. No, she gets it in like once in 4 or 5 months. And dyspnea is also becoming better, grade 2, or sometimes it even goes to grade 0 also. Sweat has improved, and cough, she didn't get that after that. Not that extreme, like her eyes, cheeks are blushing, the pain in the abdomen, no. A milder cough she gets. So in both the cases, you can see the differences. In this case, they are like excessive, like into the steroid tablets and to the inhalers. They are better with this, even in the minute doses. And the other one is they are scared of using the inhaler. Both their anxiety is there, their apprehension is there. In here, they catch cold easily. There it is not like the cold feels them better. So in that way, as a homeopathic medicine we prescribe, we have got a difference in prescribing the medicine. And other cases, if you see, we give acute remedies. So acute remedies, we repeat it very often. Acute remedies, we repeat it very often. We call it as 50 millismol, or we call it in the name of plusing potency, so that during a very acute case, they take it very repeatedly and the complaints are better. So this is my presentation. I hope I have not taken much time, and I think I have made my presentation little clearer in the view of homeopathic part. Thank you all for your patient listening. I hope I didn't offend anybody. So,
Rina, thank you very much for your wonderful presentation. We have enjoyed this very much, and there are many things that you have offered that will benefit the other Ayush modalities too. You know, particularly every time I listen to a detailed case taking that you have in homeopathy, it's very detailed and very systematic. And I feel this is something that the other Ayush modalities can also learn from how the case taking, number one. The second thing where I see a little bit of similarity where we can learn from homeopathy is this whole process of repertorization. It's a very special approach. And when I look at Siddha or Ayurveda or Unani, we see similarities in that aspect, that it is slightly more systematic in homeopathy, that you might even have some software to help you with the repertorization. I don't know whether you use a software or something for this. Yes, you do. And the last, so that is one thing where the other modalities can learn a little bit, because how you look at the symptoms and how you then distill it to choice of formulation that you give. The last one I just want to quickly comment about is prescription selection. I think in homeopathy you have 11 or 12 types of prescription selection. Am I correct? And I hope I'm correct. And that is another area where we can learn, all the other modalities can learn from Ayurveda, from homeopathy. So 3 points. One is very detailed case taking and the systematic way in which you present the cases. Maybe we can harmonize that aspect across the Ayush systems. Repertorization, the logic of repertorization.
Yes.
Because in Ayurveda, in Siddha, in Unani, there is a way in which it is done, how you select a formulation. Also, there is such a choice of formulations to choose from. And you people have that software. Maybe some point we need to learn a little more. And the last one is prescription selection. So these are very wonderful things that we can learn from. Now, I hope the way we proceed with our webinars is that we leave our questions and discussions to the very end. I take the liberty here, because I was fascinated by a presentation, to make these small comments. But please stay with us. There'll be many questions from the audience, and they will want to know a little more. But we all thank you for coming to us today. Thank you for joining us briefly yesterday and introducing yourself. And we are delighted you are here with us. We are particularly thankful to Father Muller's. It's a very, very prestigious institution in Karnataka, and we are very happy to know that you studied there, and we can see some of the high quality of education coming through in the way you did your presentation today. We would like you to bring more people from Father Muller's to our platform in future events. So please stay with us while we go through the other presentations, and then we open up for questions, discussions. Thank you again. I request Pavanji to take us forward to the next. Thank you, Prina. Pavanji, namaskar.
Thank you, Manan sir. Thank you very much. Now I would like to request Dr. K. Nishant Pai, Assistant Professor, SDM College of Ayurveda and Hospital, Udupi. Welcome, Dr. Nishant. Now stage is yours. We have to move forward on the basis of opinions of you next generation. You are the next gen for us. Dynamic, energetic, multi-dimensional. We are old person and we would like to learn. I have learned also, no doubt. Welcome.
Sir, pranam. Am I audible, sir?
Yes,
Thank
clear.
you, Nishant. We can hear you very clearly. Thank you.
Okay, sir. Okay. So
Very
first,
happy, very happy to have you from SDM. Thank you for joining us.
sir, actually, you were speaking about Father Muller's, the place where I reside. Father Muller's is in my town.
Now, I have a question for you before you start.
Yes, sir.
What is the amount of dialogue you have between SDM and Father Muller?
Pardon me, sir?
Do you have some interaction between these two institutions?
No, sir.
Why is that?
Because they are city apart. So we are staying in Dakshin Kannada district, which is almost 70 kilometers away from the Udupi district. So it's a long distance.
Prashant, Nishant, thank you for joining us today. Before I give the floor to you, one last question from me.
Sir.
Do you think we can benefit from this interaction? So I touched on 3 points: case taking, the logic of repertorization, and prescription choice. Can we also in Ayurveda also have some apps or some algorithms to make it easy for you, because we have so many formulations?
Yes, sir, definitely.
Because I've heard from our young students in Kottakkal and other places that it will be a great help if we have an algorithm and an app where we put all the symptoms in and make it a little more easy so that you don't have to remember all these complex formulations and you get the choice on the screen. Is this something that will be valuable?
So for the first point, I'll definitely agree, sir. There has to be an algorithm. But regarding the app thing, that needs expertise. Say that couple of
No, sorry, Nishant, I think you misunderstood me. When I say an app, it's to gather all that information, and to make it, to show you these are the choices, that we have so many ASVAMs, so many Irish terms that can be used here.
Sir, definitely. So there has to be a approach where one has to know that this particular ASVAM can be used in this particular condition, or this particular churna can be prescribed in this particular condition. So there has to be an algorithm that need to be developed. Yes, it's on the way, of course. So as now.
Thank you. We'll continue. Thank you, Nishant. I think, welcome to the platform. Thank you for being with us.
Can I share my screen?
Please, yes. Nishant, before you start, I can see one message from Agnihotri ji.
Yes, sir.
Agnihotri ji, namaskar ji.
नमस्कार सर। अरे डॉक्टर सौरभ का मैसेज अभी आया है, उसको डीएम ने मीटिंग कॉल किया है, तो अगर आप उसको पहले करा दें इनसे, निशान जी से पहले, अगर वो शायद पवन जी को फोन भी कर रहे हैं तो उनकी वजह से।
Nishant ji, there is a little bit of an urgency. There is one speaker, Surab, who has a meeting with the district magistrate. So if we can just swap this around, your position, if Pavan ji will permit it, we await for Pavan ji. Thank you. Pavan ji, namaskar.
Yes, sir.
Pavan ji, there is Agnihotri ji has a request that Surab ji to come in before Nishant ji, if it is possible.
Okay.
Saurabh.
We are here to support everybody, sir. Definitely, he is a new speaker. He and Nishant both.
So Nishant, just because there is some urgent meeting with the DM in Morena. So we
I
can
would like to
introduce.
request now Dr. Purwar. Dr. Purwar today only met to Dr. Agnihotri ji, and he is district Ayurveda officer in Morena near Gwalior. So welcome Dr. Purwar, Saurabh Purwar, welcome. Kindly unmute yourself. Purwar ji हैं? अग्निहोत्री सर
मुझे लग रहा है प्लेटफॉर्म पर है नहीं वो, उनको अभी फोन कॉल आया तो उन्होंने मुझे फोन किया कि डीएम साहब की मीटिंग रखी हुई है तो ही हैज टू आइदर लीव, और हमने कहा उनको पहले प्रमोट कर देते हैं। उससे फोन किया वो उन्होंने, मैंने कहा क्या आपको फोन कर ले,
लिस्ट में है?
मेरे लिस्ट में नहीं दिख रहा है।
हमारा सीक्वेंस ही चल रहा है।
नहीं
मीटिंग में है। हमारा जो सीक्वेंस था, Lord has finalized the sequence. Lord Shiva has finalized. So we would like to invite Dr. Nishant. He is the
Thank you. Apologies.
Sorry for interruption.
No issue.
Thank you. The floor is all yours. Thank you.
So can I share my screen, sir?
Stage is yours. Platform is yours.
Yes, sir. Is this visible, sir?
Here.
So
very, very clear. Thank you.
So already Praveen madam has added much of the details in terms of case taking and its treatment and selection of drugs. Similarly, in Ayurveda, this is a very important condition that comes most of the time in a clinical practice. So most of the time it may not be a acute exacerbating asthma, but the dormant asthma also comes. So that need to be taken care of in the clinical practice. Not that always it has to be subject for a detoxification, or it has to be treated with a palliative treatment, or the care to the treatment that has to be given in terms of the habits or the in terms of food habits or the regime that the patient need to be take care of. So these has to be in a very systematic manner that need to be done. So before going to the asthma care and cure, I would like to just brief the summary what already has been told by Madam in the earlier presentation. Say that asthma is a obstructive condition, that airflow obstruction is identified in the respiratory system, and this particular obstruction may not be specifically in a one particular area. It may be in anywhere in the tracheobronchial tree. Depending upon that, the presentation also varies. Say that if at all it is a major bronchi, the presentation may be different, or it may be minor bronchi, the presentation may vary. So that varies markedly. It is not that the patient walks in with a wheezing or walks in with a dyspnea into the clinical practice. Say that the patient may come comfortably, and on auscultation, it may be identified that the person is having a bronchi or a wheeze that can be identified on the auscultation. So there may be inflammation in the airway. So it is not always that allergic reactions cause this particular thing, or there may be an infection. So one has to identify these different types of presentations as the variation in the variation in the weather also may be possible. The climatic change, most of the time this happens nowadays, that this particular climatic change also causes the airflow obstruction due to the allergic reaction that occurs. So what happens is there may be wide range of triggers. So there may be wide range of triggers. It is not only in terms of climatic change, it may be in terms of food also. So patient may give a clear cut mentioning of that this particular food I have taken, and because of this there is a this presentation has occurred, or there is a severe cough, or patient may be suffering from the rhinitis, which may be a commonest clinical presentation. Say that patient initially present with the upper respiratory tract afflictions in the form of rhinitis, then in a day or two it may be continued as a pharyngitis and laryngitis. Then on the third day or the fourth day, patient may come with a dyspnea or respiratory distress. So this is the classical presentation, and sometime it may happen so that this may skip all of this particular pathological aspect and directly come to the clinical practice, say that there is some tightness of the chest without any presentation of wheeze. So all these are the variety of the presentation. In other words to say, this marked variety of presentation depends upon wide range of triggers, and this consequently reduces the airflow also. This particular presentation is depending upon the airflow. So if at all the airflow is so less, so depending upon the airflow, the presentation varies. And wheezing and the dyspnea are the two important or the predominant features of this particular asthma. And most of the time, except the status asthmaticus, which is considered to be acute severe exacerbation of the asthma, it needs a hospitalization, but others are considered to be reversible. So these are the points that need to be identified before starting the treatment of an asthma. So why this happens? So how it happens? So there are some of the factors that have already been explained, such as endogenous factors, this genetic predisposition, atopy, say that genetic predisposition in the sense. So in the modern science, it has been said that so gene doesn't express itself unless it has been put into such environment. So gene predisposition is also plays an important role, and this gene predisposition also is influenced by the environment where this particular gene expresses itself or doesn't express it, both dependent upon the ambient environment. And at the same time, atopy. So no doubt it is also atopy dependent. Airway hyperresponsiveness. So this is one such thing that need to be identified. So this we are going to speak in elaboration in further slides, where we want to identify why hyperresponsiveness is identified. So why, if at all, say that let me give an example here. Say that 10 people are going in a rain, and all may get wet in the rain. Only one or two may get cold and cough, not all the others. Why? Because their response to that particular ambient atmosphere is hyper than the others. And of course, it is also gender dependent. So that is also not gender dependent in the sense some genders may have much of the affliction of this particular thing, ethnicity, obesity. So these are some of the moderating factors of this particular asthma. And early viral infection. Early in the life, if at all a child suffers from the viral infection, that is also considered to be one of the endogenous factors why this happens. And exogenous factors, That is indoor allergens. Sorry, there is a mistake in the slide. It has to be exogenous factors. Indoor allergens, outdoor allergens, occupational sensitizers, passive smoking, respiratory infection, obesity, and diet. And some of the drugs such as acetaminophen is said to cause this particular hyperresponsiveness of the respiratory passage. In Ayurveda also, they have identified some of the Nidana factors, that is the etiological factors, that is considered to be Vidahi Guru Vishtambi Ruksha Abhishanda Bhojane. So this particular shloka here that has been mentioned is categorized into two forms. One is that which increases the Vata dosh and that which increases the Kapha dosh. Say that Vidahi Guru Vishtambi Ruksha Abhishanda Bhojane. So Vidahi Guru Vishtambi and Ruksha Bhojane. So these are considered to be Vatakar here. Shitapana Asanasthana Rajo Dhumatapani. So Shitapana Asana, these are the factors considered to have the Kapha dosha morbidity. So when there is a sthana samshaya or when there is a Kavaikunya in the respiratory system, may be due to Vata or may be due to Kapha. Say that not everyone will, some people may have the presentation depending upon the Raja, or some people may have the hypersensitivity towards the diet, or some may have the respiratory affliction towards the drugs. So this is varied. So that's why here also they have mentioned that there is a two set of nidanas. So though they have been tabulated in one particular shloka, in the commentary Dalhana says that it can be categorized under two. One is Vata Pradhana or Vata Pradoshita, and second is Kapha Pradoshita. Then comes Vyayama Karma Bharva. If at all a person indulges in excessive of exercise, Bharat Vega Ghata Karma. So if at all he involves in the excessive of exercise, excessive of walking, or excessive of weightlifting, in such condition this may happen. Amadosha Vigata Strikshaya Dosha Prokidani. So Amadosha, this Amadosha here refers to not only the dosha that are morbidity in the GI tract, rather Amadosha refers to Asthana Samshayita doshas. That means doshas which are oriented towards production of this particular disease. And Abhigata specifically refers to the pranavasrotas or the respiratory system. So the damage that might have occurred, or that there is a predisposing factor that might have caused some damage in the respiratory system, where there is a possibility that disease may occur. So this happens most of the time. The person may have the right environment in the body, so that when there is a right etiological factor, definitely causes the disease. So this has been elaborated in this particular phenomena has been elaborated in the Prameya Nidan, how it actually occurs. Vishamashana Adhyashanaha Tadaha Samashanaihi Kashvasacha Kasacha Nadamsam. So this is the commonest etiological factor for the Tamakashwa, Shwas, Hika, or Kas. All these conditions can be categorized under these etiological factors. There are more which has been explained by Charak and Vagbhat, so that I have not tabulated here. Moving on. So Samprapti, what happens here? So as I have explained, morbidity of the Kapha dosha, so morbidity of the Vata dosha. So these are invariably needed for the production of this particular disease. Say that if at all there has to be a Tamakashwas or the asthma that has to occur, there has to be an obstruction to the passage of the airway. That obstruction is caused by the morbid Kapha dosha. So Kapha dosha naturally present in the Urastha, but which is in the Prakrita Avastha, if that is in its natural format. If at all it attains its morbidity, then definitely it will cause the morbidity of Vata dosha. Obstruction of the Vata dosha. This is to some extent considered as Margavaranajanya Vyati, or the obstructive pathology of respiratory system. In other words, to say, if at all there is a Vata affliction, say that if at all excess of Rukshata that has occurred because of, say the patient is suffering from excessive of cough due to some allergens, say that due to excessive of cough, there will be increase of Vata dosha, and at the same time, due to repeated cough, there may be an inflammation which will cause the inflammation in that particular area, which will cause the morbidity of Kapha dosha. Further, they come across and play a role in terms of Margavarana here. Atra cha rajas ityadinam prayo Vata prakopa ganehe vichyadyoktaha pravartitaha gadavima jantrena Nishpava ityadinam kapakaranataha ikashvasayo kapha prakopa hetuguno abhitaha tad anena vatajanaka kapajanakaha hetuvarta. So these are the two categorizations. One is kapha karanataha and second one is vatajanaka kapajanaka hetuva. So kapha karana and vata karana has been identified. Vata kapha prakopa कफयोर अत्राः स्वहेतु कुपितत्वेन स्वातंत्रा दर्शन्ति न अनुबंध रूपा. So here they say that they may get afflicted or they may attain the morbidity independently, then they may interact. So there is no any relation, na anubandha rupatva. So there is no anubandha or there is no any prior conglomeration of this particular kapha dosha and vata dosha. Say that vata dosha may have its own morbidity, kapha dosha may have its own morbidity due to the specific etiological factor that I mentioned earlier, and then they may have interaction in the form of samprapti in the sthana samshaya, and then it may produce a disease. See, that's why there is a variety of presentation. Say that not all the time it is the kapha and vata comes together. In some condition, it may be identified that patient will have excessive of chest fullness with the B's and the bronchi, and sometimes this particular chest tightness is very minimum, but patient will have dyspnea and the bronchi. So these are the two different conditions where we can identify that kapha prakopa and vata prakopa are independently might have identified got morbidity, and then they come into the picture. So this is what happens according to Charan. Then coming to the samprapti further, so this causes the obstruction of the respiratory tract, that is for sure, and this is the ultimate pathology that comes, that obstruction to the vata marga by the kapha. So morbid kapha that has already occurred due to nidana that has mentioned in the earlier slide, and morbidity of vata dasha that has already been identified in the earlier slide. So there is an obstruction in the respiratory passage to this particular vata, and there will be gurgling sound, gurguraka. So this gurgling sound and the dyspnea, so shwasa. So this occurs. Shwasanam samprapti yada srotamsa samruddha. This is the obstruction. Maruta kapha purvaka, because of the kapha to the marta. Vishwagrajati. Vishwagrajati in the sense, this is sarva sharira vyapta. So that particular allergen which is causing might be present all over the body, but specifically it is oriented towards the respiratory system. That's why it causes the respiratory tamakashwas or the asthma. Pratilomam yada vayu srotam se pratipratya. This is a very common shloka that is identified. Grivam shirascha sangraya shleshmanam samudrya karoti pina satena udva gurgurgandura ativa tivra vegam cha shwasa prana prapita. That means here karoti pina satena udva gurgurgandura. So this is one such presentation where I explained in the earlier in the beginning of the presentation that it may start classically with the respiratory infection or respiratory affliction in the form of rhinitis. Then patient may have the upper respiratory infection of laryngitis, pharyngitis, then it becomes a tracheitis, and then becomes a asthmatic condition. So karoti pinasatena rudva. So starting with the pinasa, then comes the gurgurakaha and ativa tivra vegancha. So then the vega of this particular disease may increase, and it may become shwasa prana prapedakam. That means it may become status asthmaticus, acute exacerbating asthma. Acute exacerbating asthma. So this is the total course of this particular illness, starting with the pinasa till the prana prapedaka. So everything encompasses in this particular symptom. So mechanism of asthma, it is a chronic inflammatory state. So chronic inflammatory state, that inflammation will be triggered by the allergen, and this particular allergen, though some are hyper responsive to some type of allergens, and this causes an inflammation in the respiratory mucosa and acute inflammatory disease. This is an acute inflammatory disease that comes in an episodes and with an exacerbation asthma. So not that the patient will be having this particular dyspnea and the wheeze throughout the lifespan or throughout the month or throughout the week. There may be acute exacerbating episode and there may be symptom-free period. So both have been explained. So that is from the in the last slide I have explained, that is pinasa to that of prana prapedaka. In any of these form, it may be present. Further, so hyper response are considered as a asatmya. So here satmyam nyama tad yad atmani upashete he satmyam hi upashayata. So that which is considered as upashaya or that which is considered as palatable or wholesome to the body. So that is suitable for the body, and that which is consumable, which may be good or bad, that's a different issue. Then asatmya is the bad, so which may produce health or the disease. Satmyam nama yad tad yad asatmya yad atmena upashete satmyam hi upashayartam. Samiksha samyak atmanamiti mamedam satmyam mamaidam asatmyamiti. That means this is good and this is bad. So this is something considered as Atma Satmya. Rather to say Satmya, this is Atma Satmya. So there are different types of Satmya. Say that there may be Rutu Satmya, Ahara Satmya, Pana Satmya. So similarly, there is something called as Atma Satmya. The same example I would like to quote. Not everyone will get this cold when they are exposed to the same kind of breeze or same kind of cold environment. Say that 10 people may be working in an air-conditioned room or air-conditioned space. Not everyone will get the cold. So those who are hyper responsive to that particular condition may respond and produce a disease. That's why they have very clearly says in the classic, that is mama idam satmyam, mama idam asatmyam. So one should know that this has to be satmya. This is satmya to me and this is asatmya to me. I will tell you why this is very important, because this particular mama idam satmyam, mama idam asatmyam is very important, or the crucial plays a very crucial role in planning a treatment. So one has to identify what are the etiological factors causing specific respiratory affliction in terms of Tamakashwas to that particular person, and he has to avoid it. And those which are considered to be wholesome, that need to be taken. So here, this is something called as Atma Satmya. So, sorry. Similarly, I have said that there is a Rutu Satmya also. Similarly, Ahara Satmya. So that everything need to be identified. Having similar properties and derogatory properties need to be identified. Having opposite property or complementary property, that need to be identified. That is Satmya and Asatmya. That which is wholesome, unwholesome, need to be identified. Anye punaha prakriti vayo desha artu dosha vyadi vashena satmyam bahuvidha ichanti. So depending upon the prakriti satmya, vayo satmya, desha satmya, dosha satmya, vyadi satmya. So similarly, satmya can be different types. So upashaya matram angikritya viparita gunam api upachareణ satmyam. So that which is here, that which is good for the condition to reduce kapha and vata has to be considered as satmya. Tulya gunam cha anupashayat asatmyam. So tulya guna is considered to be asatmya because there may be morbidity of the kapha dosha that may increase, or the vata dosha may be increased. That has to be identified. Techa janmanaha prabhutya abhyasthena. So some people may consider that unwholesome. Say, so here we will not confuse ourselves with apatya and satya. So apatya is something different, that which is considered as apatya and patya. So patyam padavanapetam yadyachhati manasapriyam. So that which is palatable, that which is wholesome to all, that is different. So here we are considering a individual. So here individually one should know that mama idam satmyam, mama idam asatmyam. That which is wholesome to him and that which is wholesome, not wholesome or unwholesome to him. In other words, to say that one has to choose what is good for him, one has to choose what is bad for him. So depending upon that, the whole of the crux of this particular treatment works. And to add to this particular matter, say that in classics also it has been very well said that if at all something that is apatya and is consumed over a period of time, that may become okasatmya, but still text clearly put a barricade that it should be avoided. So even though apatya has become satmya, that means that which is not complementary to the body, and due to the habituity that has become the wholesome, that may act as a wholesome to the body, but that should be avoided immediately. So asthma care, starting with the asthma care, how it has to be done. One is avoiding the etiological or the exogenous factors, such as mama idam satmyam, mama idam asatmyam. Now we have to know that how it has to be identified. The person has to identify if at all he has suffered from this particular allergy in the past, that need to be avoided. Then you have to strengthen the endogenous factors, such as endogenous environment, rather I would like to say, considering the complementary factors in the form of patya apatya, avoiding the derogatory factors such as apatya, preparing for the seasonal change. Most of the time this plays a very important role. So all the others are in our hand. Say that avoiding the etiological factor or strengthening our inner environment or identifying the patya and apatya, these are all in our hand. But seasonal change is not in our hand. So that need to be identified and that need to be strengthened. That we'll discuss. So say that first we'll start with before the seasonal change, we'll start with avoiding the etiological factors. What has to be avoided? Rajasa dhuma vatabhyam शीतस्थानाम्बुसेवना व्यायामात् ग्राम्यधर्मात् अध्वा रुजान् अन्न विषमाशनात् आमप्रदोषात् आनाहात् रौक्ष्यात् अति अपतर्पणात्. So here Rajasa Dhumavatavyam, so that dust and the fumes and residing in the cold atmosphere, which is considered to be derogatory to that particular respiratory system. Vyayamat, Gramya Dharmat, so excessive indulgence in the exercise or walking or the sexual activity, and consuming excess of Rukshana Vishamashana. Rukshana refers to the most dry food items, and Vishamashana refers to Akale Ashanam. So nowadays it has become a habit that people doesn't take food at a proper time. Say that they take food because it is a time for them to consume the food. Say that 9 o'clock they may have the food, they may take their breakfast, and immediately 11 o'clock, because 12 o'clock meeting is there, so 11 o'clock they take their food. So that may be the condition today. So this particular thing need to be identified, and we need to advise the patient to take food at a proper time and take the food which is not too much causing kapha morbidity or not causing too much vata morbidity. Then anaha. So anaha here refers to as taulyam by Ashtanga Hridaya. So even obesity plays a very important role in this particular disease and asthma. So one has to not involve in excessive of exercise, excessive of walking, or excessive of sexual activities, and he should not reside in the environment which is very cold, and he should not expose himself for the dust and the fumes, which may cause a derogatory effect over the body. At the same time, ama pradoshat, anahat, raukshat, apatarpana. So one should not emaciate himself too much. So that is, and one more thing, anaha, that is taulya. Either too much nutrition is bad or too much non-nutritious condition is bad. So it has to be avoided. So these are the factors that are very important to explain the patient about what to do and what not to do. Then comes the endogenous factors or the body, maintaining the harmonious internal environment. So as I have already said, satyam tat yad atmanam upasheti. So that which is palatable, that which is wholesome need to be identified, and a balance has to be maintained. Sometimes it may happen so that the person may have to attend a feast where he cannot avoid all the foods. So in such condition, if at all he takes the food, and he need to take care that the kapha dosha may not attain morbidity. Say that a person attains the wedding function, and he may have to eat the ice cream. He might have eaten it, and then if at all he comes home, and again it may be the hot summer season, and he takes the cold water, that makes it difficult. So he had to take care that a balanced approach has to be there. So where he has to avoid and where he has to consume. So he should identify himself as Atmanam Upashete, that I have to take this or I should not take it. He had to decide that. That which is complementary to the body and the mind has to be taken. Adapting to hypersensitivity. So this is something called as focus apnea. That is tatra avara madhyabhyam satnabhyam krameneva pravaram upapadayet satmi. Say that in the clinical practice it may happen so that the respiratory affections are more common in the winter season as well as the rainy season, and in the summer season there may be very minimum cases or very low morbidity of the dosha. So what has to be done? So if at all we are planning for the treatment, it has to see that, so for one particular season, say that summer season, and the coming season may be a rainy season. So if at all in the summer season the patient does not have any symptom, at least he has to continue the medication till the completion of one particular rainy season. And if at all he is fit enough or he doesn't have any episodes of that particular in that particular season, then one can plan of tapering the medicines or tapering the aushadha that has been given, but he has to continue the avoiding the etiological factors and to identify satya and asatya to him. So it is what has been said that if at all patients say that in the summer season, can I have ice cream? Yes, of course. If at all he doesn't have an episode over a period of time, say the patient has been started with the medicine for 1 month and doesn't show any symptoms, but patient wants to eat an ice cream. So you can advise him that from the avara madhyabhyam satmabhyam krameneva. So slowly he has to act. The quantity also plays an important role, and the time factor also plays an important role. So in the classic, it has been clearly said that those which are considered to be Madhura Shita cannot be taken in the night. So ask him to avoid these Madhura Shita aharas in the night or ice creams in the night. Ask them to take in the afternoon or before the sun sets. So slowly, if at all this is habituated, then there may be chance that it may become satmya. This is called as, this is the beauty of the oka satmya that we have. Coming to the preparing for the seasonal change, this is very important here. So there is a from one rutu to another rutu, there may be a climatic change, and this climatic change is not in our hand. Satmya is in our hand, asatmya is in our hand, the patya is in our hand, apatya is in our hand, and maintaining the internal environment is in our hand. But this particular internal environment is open to the environment, open to the external environment in terms of respiratory system and the GIT system. So how it has to be maintained? Say that we need to identify Rutu Sandhikala. So Rutu Sandhikala that has been mentioned, that is 7 days of end of the season and 7 days of the start of the season. Say that 7 days of end of the summer season and 7 days of starting of the rainy season. So that this is called a seasonal transition or the transitional season period. So this 14 days, one has to follow a proper methodology of food here. Slow tapering of the earlier seasonal food habits and increasing and adapting the seasonal food habits of the coming season. So this is what has been explained. See, I will read out here. Tasmin Rutusandho Purva Sambandhi Vidhi Kramat Tyajya Uttara Sambandhi Kramat Sevya. So the earlier food has to be stopped slowly or tapered down. Then you have to start with the coming seasonal, the food of the coming season. Sahasa hi Tyagashilane Kriyamane Asatmika Rogasu. Suddenly, if at all you stop, say that not considering this particular Ruti Sandhikala, if at all person suddenly stops any type of food, he may have a Satmya Roga because that particular food is Satmya to him. That is Atma Satmya. Kramo Yataha Rutu Sandhe Pratame Dine Purvasya Aharasya Trayapada. So in the so let me read out first, then I'll go with the explanation here. So Pratame Dine Purvasya Aharasya Trayapadaha Uttarasya Ekaha Dvitiya Purva Eva Aharaha Tritiye. So that is third day. Pratama Chaturte Purvasya Dau Pado Uttarasya Dau Panchama Shashtyo Pratamavat Saptame Chaturtavat Ashtame Purvasya Eka Uttarasya Trayaha Navama Dashame Ekadeshu Chaturtavat Dvadashe Ashtamavat त्रयोदशी उत्तर एव आहारः चतुर्दशी अष्टमवत् अतः परन्तु उत्तराः एव आहारः अमुचक्रमं पादेन अपत्यम्. So this is the explanation here. Day 1, 3/4 of the food of the earlier season and 1/4 of the coming season. In the day 2, food of the early season, whatever he was taking in the earlier season. Day 3, like the day 1, that is 3/4 of the earlier season and 1/4 of the coming season. So here we can identify this in terms of combination of food. Then day 4, 2/4 or 50% of the earlier season and 50% of the coming season. On day 5 and 6, like day 1, that is 3/4 of the earlier season and 1/4 of the coming season. And the day 7, like 50-50%, that is 50% of the earlier season and 50% of the coming season. So the 7 days are complete. Till 7 days to go now, still 7 days to go. That is, from here again it reduces. That is 75% of the earlier season and 25% of the coming season. And 9th, 10th and 11th, like day 1 again. So that means, so there will be a mixture. That is 75% of the earlier season and 25% of the coming season. Then day 12, like day 8, that is again 75% of the earlier season, 25% of the earlier season and 75% of the earlier season. Day 13, the ongoing seasonal food, that season that has already come, that food. And day 14, like again day 8, that is 75% of the earlier season and 75% of the coming season. So, and day 15 onwards, he can consume his regular seasonal food habits. So for this to complement, we need to also identify Rutucharya or Rututaha Ahara that has mentioned in the Ayurveda. So that need to be identified. I have not mentioned those here. So I have just inculcated only how it has to be transitional shift in the food habits that has to be done. Then coming to the rasayanas here, Nitya Rasayana especially, good conduct, speech behavior, that has to be there. Stress free, as madam has already said that in the earlier cases, that stress is one of the common factor that present with this particular disease here. And so stress free, control over the senses, proper sleep and work, consumption of milk and tea, understanding of the environment and the situation. This has to be there. So this is given in terms of Ajasrika or Nitya Rasayana here that has mentioned. So coming to the cure of the asthma. So till now we are discussing only about the care of the asthma. So coming to the cure of the asthma. So hikka shwasabhidam, snigdhe rado, swede rupachari, aktalavanatilena, nadi prastha sankare. So this is the acute exacerbation stage. In the acute exacerbation stage, patients has to be given with the external oleation with brahat sendavaditela and nadi sweda to that particular part. And here nadi swedas, one can specifically use dashamula kashayam, that is considered to be vatahara, which reduces the morbidity of vata dosha or liquefies the kapha dosha here. So what this particular plan of action does is this humidifies the obstruction and liquefies, so that the obstruction that has caused to the respiratory system will be reduced. That is, tairasya ghadita shleshmaha srotosva abhivilayati kani mardam yanti tato vatanulomata. So it will help in easy movement of the vata dosha, vatanulomana, that also occurs. Then tata shleshmani samruddho vamanam paye. So immediately after the brahat saindavaditela abhyanga and nadi sweda, one can also go for vamana here. So as far as the vamana is considered, so this is done in a acute exacerbation state where kapha dosha is eliminated from the upper orifice. Shleshmana samruddho vamanam paye. Then, in the acute exacerbation state, vamana is the choice, that is therapeutic emesis. So here, person do not have to go to the snehana or swedana here, or directly go to the vamana. That is, this is called as sadhya vamana. So if at all patient is in symptom-free period, as I have already said, that there is two possibilities. One is patient is in the symptomatic state or asymptomatic state. If at all the patient is in the symptomatic state, person can be given with the sadhya vamana. Or if at all patient is in the symptom-free or asymptomatic phase asymptomatic phase, person can go for pramataha vamana. In pramataha vamana, patient can be given with the Kantakari Grita or any Grita that are very specific to the respiratory system, and that dose is dependent upon the host of the person or the digestive capacity of that particular person. And after that, patient is subjected for Abhyanga and Bhaspasveda, then Vamana is given. So this is one possibility. Or patient is in a symptom period, then the person can be given at Satya Vamana. Fitness need to be considered. So a person has to be physically fit to give this particular procedure, or patient is subjected to this particular procedure. So moving to the another shodhana, that is a virechana. So what we have identified, that patient has to be given with the vamana, the dosha will be removed from the upper orifice, or detoxification occur from the upper orifice. Similarly, if at all patient is in an asymptomatic phase, one can also go for virechana. So here it is followed in the episode free period. Baliyasi kapakraste vamanam virechanam. So this has specifically said by Sushruta here. Baliyasi balayukte purushe, that the person fitness has to be considered. Vamanam sa virechanam mrudu hitam. So one thing has to be identified, that the whatever the virechana or vamana or the therapeutic purgasis or therapeutic emesis is induced, it has to be of mild intensity. It should not be of moderate or severe. So one need to identify that mrudu virechana or mrudu vamana has to be given. So therapeutic purgation or therapeutic emesis, both has to be considered under mrudu vamana or mrudu virechana. So here also you can go for nitya virechana or pramatha virechana. Again, it is dependent upon the fitness. If at all person is fit enough to go for pramatha virechana, person has to be given with a client has to be given with a snehapana, then go for 3 days of abhyanga and bhaspasveda. Then the person can be given with the virechana, vitreha, or any of the virechana. If at all person is physically unfit for the pramataha virechana, person has to be subjected for nitya virechana. Here one thing is stoka dosha niraharan, that detoxification done in a minimum quantity over a period of time. Say that nitya virechana can be administered for a period of 7 days, or 14 days or 21 days, that depending upon his condition, till the remission of symptoms. Here, the dosage is to be specific, that the same Virechaka Dravya is given in a very minimum form. Say that if at all I want to administer 50 grams of Triputleha for a Pramata Virechana, the dosage will be reduced to 20 grams in a patient of Nitya Virechana, where he will be comfortably passing 2 to 3 times of loose tubes and doesn't cause any much of the stress over the body to the of the patient. Moving to the what has to be done after Shodhana. So once the Pravruddhavastha dosha or Bahudoshavastha is addressed, then the Leena Doshavastha has to be identified. That once the Vamana is over, there will be most of the Kapha dosha is already explained, or most of the detoxification is already done. Then the palliative approach has to be done. So here light compatible food in the form of soup or gruel is given. Sinnam Nata Tataschaha Bhojitva Rasodram Vata Shleshma Vibandhecha Bhishak Dhumam Prayoje. So to address the Leena dosha, or the whatever the remnant kapha, morbid kapha that is present in the respiratory tract, that need to be pacified in terms of therapeutic smoking. And for this, a specific drugs such as Gugulu, Haridra, Devadaru, Manashila, these are used. So Manashila, Devadaru, Haridra, Chadanam, Amisha and Gugulu here. So that is given. So for the palliative care, one can go with the in my clinical practice, I have been following this, that Pushkara Mula Sava 50 ml TID, Kanaka Sava 50 ml TID, Shwasa Kuthara Sava 125 mg thrice a day, Shwasa Chintamani Sava 125 mg thrice a day, Haridra Churna 2 to 5 grams daily with honey, or Marich Churna with 2 to 5 grams daily with honey, Vyagri Haradiki Chitrakaritaki Avaleha 50 grams twice daily with a lukewarm water in empty stomach is advised. These are some of the Shamana Aushadhi that can be used. So, coming to the disease specific rasayana, say that Vamana removes the Kapha dosha and facilitates the Vata dosha. At the same time, Dhumapana helps in the addressing the Leena dosha. And finally, come to the disease specific rasayana, which may help in reducing the episodes or remission of complete disease. Cure may also be possible. Here, Yashtimadu Rasayana, Balamula Rasayana, Bhargav Prokta Rasayana, Vardhamana Pipale Rasayana, Dashamula Rasayana, Muduchi Rasayana. These are some of the rasayanas which have been tested and tried in the patients who are suffering from Tamakashwasa. So, Yashtimadu Rasayana 10 grams daily, Balamula Rasayana 24 grams in a divided dosage, Bhargav Prokta Rasayana 15 grams twice daily, Vardhamana Pipale Rasayana in a increasing dosage or a static dosage, both can be followed depending upon the physical fitness of the patient. Dashamula Rasayana 12 grams in a divided dosage, Muduchi Rasayana in 24 grams in a divided dosage can be best practiced in Tamakashwasa. So before last, obstruction to the Vata by the Kapha dosha is the pathology. Etiological factors play a very important role. Exogenous and endogenous factors should be considered. Seasonal change influences the condition. That's why seasonal change need to be addressed. Food, environment, and treatment is the plan. Complementary derogatory factors should be considered. In a nutshell, Kapha and Vata has to be treated. Shodhana, Shamana, Rasayana are the treatment. Shodhana in the form of Vamana and the Virechana. Sadyomana, Nitya Virechana can also be considered if a patient, Sadyomana can be planned if at all the patient is in the acute exacerbated state. Nitya Virechana can be planned if at all the patient is physically unfit or patient Bala of the patient is less. Dhumapana in Leena Doshavastha has to be followed. Shamana Aushadhi can also be planned over a longer period of time. Vyadhihara Rasayana has to be administered to identify the remission of this particular disease or complete cure of the disease. Thank you.
Nishant, thank you. Thank you very much for this wonderful, very detailed
Excellent, sir. Bada gajab, mesmerizing. Presentation was mesmerizing, sir.
Very, very detailed.
Mr. Dr. Saurabh will join after 15 minutes.
Okay, thank you.
So we can start. Stage is yours, sir.
Thank you. We'll
Excellent.
Continue. We wait for Saurabh ji. In the meanwhile, we can start our. The floor is open for discussion. I can see Harish Vermaji is here. Today was a special day because we brought together homeopathy and Ayurveda onto the same platform. And I have already offered some of my thoughts and comments. I put some things in the chat box about where we might be able to benefit from bringing some kind of thinking from the two sides for the benefit of everybody. I can thank you for raising hands. I give the floor to Madhu Sharmaji. Madhu Sharmaji, Madhuji, namaskar. And then we
Hariom. Yes. Thank you, sir.
Namaskar ji. Namaskar ji.
Hariom, all
Thank
of you. First of all, I must congratulate Dr. Nishant sir and Dr. Preena Jain madam for this wonderful presentation. I have, sir, Googled on this asthma care and cure today, and I just came to know that asthma cannot be cured. Only we are curing only the secondary infections or symptoms. My view is that first of all, the patient should know the allergens which trigger asthma, and these allergens should be avoided. So this is my view, sir.
Thank you, Madhu. I think this was raised important point about preventing the triggering the condition. I think Nishant might want to address this before we get Swagatji will also join, but Nishant, or would you like to address this point? I think it came through very clearly in your presentation about how you have to be careful about the triggers. And you gave also, I would just want to say that you also pointed us to
केमिकल और पान में भी देखा है कि किमाम जो होता है उसका केमिकल घुसता तब तकलीफ
Pavan ji ka microphone. Pavan ji, mute yourself. Okay, muted. Okay, thank you. And Nishant, you also touched on a very important point that is very I understood, which is the Ritusandhi Kala and management. So I would like you to just address Professor Madhu Sharma's question. Professor Madhu Sharma is Professor of Botany in one of the colleges in Uttarakhand, very old college in Uttarakhand. I'll leave it with you. And then we take a question from Swagatji or comments. Thank you, Nishant.
Sir, as far as the allergens are concerned, so allergens cause only disease when there is a favorable environment. Say that if at all the body responds to that particular allergen, then only there will be a specific presentation. So if at all, so that's why I said that it is not only the exogenous factor, it is also the internal environment that need to be prepared for this particular condition. And we are not saying that that patient can be given with some magical medicine and it's cured. It has to be given for over a longer period of time. So that say that if at all patient is given medication over a period of months, and after that there is no any symptom, then there is a possibility that environment plays a very important role. And patient has to be very meticulous in identifying an allergen and avoiding that. And identifying etiological factor and avoiding that in the earlier days of treatment. Then once there is a symptom-free period, asymptomatic period, there is no any symptoms there, then the person can take some of the etiological factors. As I said, that ice creams is one of the etiological factor that has been identified in the summer season, and that too specifically in the mid of the in the afternoon when the sun is on the high. In such time, the person can go for minimum dose of those etiological factors. So make him satmya to that. That is called as okasatmya. That is the concept of okasatmya, or what we call it as adaptation to the allergy. So this is one concept that is already present in the modern science, where they adapt to some kind of allergen by giving a low dose of allergen over a period of time. So this can happen in two ways. One is you create such a stronger internal environment, allergen won't cause any hyper-responsiveness, or you make yourself adapting to that particular allergen. So this takes a longer time. So here we are specifically prescribing the rasayanas, which are considered to be naimitika rasayanas. So in the last slide, I mentioned about the naimitika rasayana in the form of Bhargava Prokta rasayan, Guruchi rasayan, Yashtimad rasayan. These play a very important role in giving a strengthening the internal environment of the body against a specific disease.
Nishant, thank you for elaborating. I don't know, Madhuji, is that, I hope it satisfies your...
Yes, sir. Thank you very much, sir. Thank you, Nishant, sir.
Nishantji has used some very technical terms that you might find slightly difficult initially to understand if you're not familiar with Ayurveda, but you can always contact Nishantji. His contact details are on the last slide, and maybe he will put his contact details also in the chat box for us to engage. Madhuji, you can also put your contact details in the chat box so Nishant can take it and have a chat with you. I invite Swagatji. Swagatji, namaskar.
Sure,
Swagatji is joining from Agra. Namaskar.
First of all, I would like to congratulate Dr. Nishant for a wonderful presentation. I respectfully, if you take out the video of Nishant, I was seeing my Guru, Dr. G. Srinivasacharya, even the slides and the vocabulary, I saw him. And fortunately and unfortunately, fortunately today is his birthday, Dr. Srinivasacharya's birthday. Unfortunately, he is not with us today. We lost him last year. And he was an expert in asthma, and we all miss him today. He had an asthma clinic. We had an asthma clinic, a separate clinic for that at SDM Udupi, and he was very much into it. And one thing I want to add for Madam's comment: asthma is curable, especially Tamakashwasa is curable within 1 year of time as per Ayurveda. That is when it is new or Navina, what it is. If it becomes older or Purana after 1 year, it is not curable, but it is controllable. That is how it has been explained. But what else we see, the exogenous factors that we also should understand as per Ayurveda. Some diseases, they mimic Pitta Jakasa and Kapha Jakasa. In Pitta Jakasa, when there is association of Kapha, and Kapha Jakasa, when there is association of Pitta, they mimic the Tamakashwasa, that is asthma. So in that particular time, the treatment is entirely different. We have cured a lot of so-called asthma conditions on the basis of diagnosis of Pitta Jakasa. That is, we do just Nasya and Dhumapana, and it will be in 2 course or 3 course, they get cured. For my first patient was my mother. She suffered for 25 years with all sorts of treatments and inhalers, everything she tried. And finally, we diagnosed her as, I diagnosed after completing my PG, I diagnosed her as Kasa, and we treated on the grounds of Kasa. And she's completely normal now. She doesn't need any such sort of treatment or medication. Otherwise, since my childhood, I have seen her with all sorts of Deriphyllin, Aminophylline, everything was given to her, inhalers, steroids, and even some allergy centers at Bangalore, very famous allergy center at Bangalore. She's been treated, but she did not get relief. But at that particular time, after diagnosing this as Kasa, she got cured. That is how, why I was telling this is, Madan Tangavali sir was asking, can we make an app for this? We can make an app for all these medicines, but the diagnosis in individual patients with the symptoms it must be more accurate with the physician. Thank you, sir. Thank you for giving me this platform. And I also thank Nishant for wonderful presentation.
Swagaji, we are, number one, we all miss Srinivasacharya ji, very, very special person. It is unfortunate that all of a sudden, out following an operation, he somehow had abscess. So we miss him very much. And his presentations, as you say, were very, very special. I didn't know about the special asthma clinics that he did in Udupi, but
yes, sir. When I was doing my PG, we had an asthma clinic at SDM Udupi, and it was a special clinic for that only.
Thank you. And you are right in saying we can see in Nishant ji's presentation, Acharya ji's continuation. So that is a very important point.
Even today, his OPD is changed to Nishant Pai.
Yes. So Nishant ji, we can see in your presentation, Srinivasacharya's tutelage. Thank you so much. We miss him very much, but we look forward to you to continue that parampara, Srinivas ji's parampara. And Swagaji, I'm so happy you are here and elaborating, because you have taken your mother's condition and you have shown how it is treatable. I think there are many people, not only Madhu Sharma, but many people who are asthma, so-called asthma sufferers, who would benefit from what you have shared today. And I hope we can make this a slightly more, we can open up this discussion to a much larger international audience so that they can really, and we look forward to both of you, Nishantji and yourself, to guide us in this process, Swagaji. So
much
because you have trained with the master, you have trained with Srinivas Acharya-ji, you have learned it, you have sensed his clinical skills.
I think that it was some Purva Janma Krita Punya, sir. That's all. I met him.
And today being his birthday, I think we just remember him once again for all the students he has produced, for the way in which he ran SDM Udupi as an institution, and the way he connected with all of us here in London. He used to travel to London, come and teach us here. So we miss him very much. But very happy to see that that lineage and that parampara is being continued. Swagaji, you are there, and Nishantji, you are there. And finally, Swagat, thank you so much for elaborating how we can do diagnosis. If you have the diagnostic skill, you can distinguish something which is very treatable.
Yes.
And I think this also answers Madhuji's question. So Madhuji has put her details there from she's professor of botany at one of the colleges in Uttarakhand. And I hope we can start interacting like this so that all these issues can be discussed more. And more importantly, I would like to see, Swagaji, how we can, and Prashantji, how we can, Nishantji, how we can bring this knowledge to people out here in the West, in Europe. Thank you so much. I noticed that Johari-ji, Anil Johari-ji was here with us till now, but he has left us. And it's a pleasure to see Anil Johari-ji here on this platform. I'm curious what brought him to the event today, whether he has any asthma-related problem and whether we could have offered a solution. He will be listening to our recordings later on, so he will hear all this that we have discussed today. So thank you, Swagaji, for your for elaboration. I don't know if you have anything else to add, but if there isn't, please wait with us, because I want to bring Harish Verma-ji from Toronto. And please wait with us, Swagaji, because Harish-ji always has some interesting insights. Harish-ji, pranam.
प्रणाम सर, नमस्कार सभी आचार्यों को, नमस्कार नमस्कार। आज टुडे आई मिस सम लेक्चर, अभी जो डॉक्टर निशांत जी का लेक्चर मिस कर गया बिकॉज मॉर्निंग टाइम है यहाँ टोरंटो में। तो बट मेरे 2-3 क्वेश्चंस हैं सर। एक तो आई लिसन्ड होम्योपैथिक डॉक्टर प्रेरणा, उसमें उन्होंने एक तो आर्सेनिक की बात की कि आर्सेनिक जो है अस्थमा में, एस्मा में देते हैं। पहले तो मेरा पॉइंट ये था कि जो एस्मा या अस्थमा जो है, इसमें डिफरेंशियल डायग्नोसिस इज ऑलवेज वेरी इंपॉर्टेंट। कई बार जो सार्कोडोसिस और अदर कंडीशंस होती हैं, फिर इवन द स्टेजेस इन अस्थमा वो भी मैटर करता है, क्योंकि इसमें लेटर स्टेजेस में बहुत ज्यादा कंडीशन खराब हो जाती है। ब्रोंकाइटिस, लॉन्ग टर्म ब्रोंकोडायलेटर्स लेने के बाद ब्रोंकाइटिस हो जाता है। इन सब चीजों के बारे में थोड़ा सा मैं चाहता हूँ स्वागत जी बताएं कि एस्मा के बारे में एक तो डिफरेंशियल डायग्नोसिस और उनकी जो कोरिलेशन है अगर आयुर्वेदा में, वो कैसे हो सकता है। जैसे ब्रोंकियल एस्मा हम लोग तमक श्वास के साथ कोरिलेट करते हैं कि इज इट करेक्ट, नंबर 1। नंबर 2, अगर ब्रोंकियल एस्मा में inflammatory, it's an inflammatory stage as well as allergic and inflammatory, तो इसमें क्या एंटी इंफ्लेमेटरी मेडिसिन जो है, जैसे बॉसवेलिया सेरेटा, कर्कुमिन, दिस ग्लाइसिराइजा, हम लोग काफी यूज करते हैं यहाँ कनाडा में। मेरी जो एस्मा की मैनेजमेंट है उसमें हम लोग बॉसवेलिया को बहुत यूज करते हैं। बॉसवेलिया, कर्कुमिन, ग्लाइसिराइजा, ग्लेब्रा, क्योंकि यहाँ हर्बल मेडिसिन को ही प्रेफर किया जाता है। तो तो ये मेडिसिन क्या वहाँ इंडिया में भी यूज होती हैं या आप लोग इसको कैसे मैनेज करते हैं? तो एक तो आर्सेनिक के बारे में थोड़ा बताएं कि
Thank you.
मेरा कॉन्सेप्ट आर्सेनिक के बारे में ये है कि ये ज्यादा जो बलगमी खांसी होती है, जहाँ म्यूकस प्रोडक्शन होता है, वहाँ हम लोग आर्सेनिक के प्रोडक्ट यूज करते हैं, जिसमें जिसमें ये जो मल प्रेपरेशंस होती हैं, मल भस्म है, स्मीर पन्नग रस है, स्वर्ण स्मीर पन्नग रस है, ये एज्मा में हम लोग कभी कभी यूज करते रहे हैं इंडिया में, लेकिन वहां यूज करते थे जहां पर बलगम ज्यादा होती है, जहां म्यूकस प्रोडक्शन ज्यादा होता है। लेकिन क्या क्या होम्योपैथी में भी इस तरह का कोई प्रिंसिपल है? ये तो डॉक्टर प्रेरणा से क्वेश्चन है। दूसरा स्वागत जी से क्वेश्चन है कि ब्रोंकाइटिस में जो लास्ट मतलब काफी क्रॉनिक हो जाता है, तो वहां पर हमारी कौन सी दवाइयां काम करती हैं? थैंक यू सर, थैंक यू।
Harish ji, thank you. I think, I hope Preena ji has joined us. Preena ji, namaskar. Now, I don't know if Preena ji
Yes, sir.
understood. Preena, do you
Yeah.
understand Hindi is the first question.
Oh, I didn't get it, sir. What he was.
You didn't get the question. Okay, now we will get Harish ji to give that. Let me see if I can translate what Harish ji asked. In one of your case studies, the first case study, you used arsenic album 200 C.
Yes, sir.
So Harish ji's question is, how did you choose this? And how do you justify the use of arsenicum in one patient and something else in the second patient, you know? So that is, I think, approximately Harish ji's question. How do you do diagnosis? And how do you choose the formulation?
Yes, sir. So actually, homeopathic medicine we give based on the totality. So the second case you see, like that lady's case, she is obese, she sweats a lot, she's exerted, and she's very apprehensive, and she has got lot of thoughts about her future, and she has got like when we look into her respiratory complaints, she has got that a cough that is tickling in nature, which is worse at night, and morning she expectorates something. She has got the suffocating spells she has got. And she has got the grade 3 dyspnea, which is worse by climbing up and climbing down. And we could also see that in detail when you go into her case, she likes eggs. And she craves for milk, but milk always, even though she likes, she doesn't like it. So these kind of people, those who sweat a lot, those who are very weak, those who like cold food, but whenever they take the cold food, they fall into trouble, they catch cold very easily. So all these people, when we put a totality, in homeopathy, like as I told before, when we put a totality, the totality leads to calcarea carb. And since this person is suffering from her bronchial asthma for the past 11 years, and she's been on modern medicine treatment with steroids and inhalers, literally there would have been some changes would have happened. So I have given 200 potency. So 200 potency is towards the pathological changes. But if the same person, when she comes with acute complaints, when she has got that severe tightness of chest with extreme exhaustion, we go for 50 millismol scale, which is a very minimal potency, which we dilute it in water and with a few drops of alcohol, and then we success and then we give to the patient, which can be taken as 3 times a day or 4 times a day, depending upon the severity of the symptoms. And now the first case. So the first case, whatever sir has asked about arsenicum album. So arsenicum album, we can see that in this case, in this case, the person, the main characteristics, when I put the totality, the main characteristic of the person is restlessness. He's not able to lie down in the bed. If he lie down also, he's mentally restless. with his future, thinking about his disease, what his disease will happen, will his children will be affected, or he just thinks about his job. He is like very obsessed with his nature, and we can say that he prefers cold, but he cannot take it. His stomach becomes acidic. He has got GERD. He has got repeated belching, and he has got a tightness of chest. He uses extra respiratory, that is our muscles, voluntary muscles for respiration he uses, and what else you can say? And he has got the sleep disturbance is the main thing, and anxiety is there, and anxiety in the early morning. And he has got, we can see like more towards when he go for his respiratory complaints. When we go for his respiratory complaints, he has got that dry cough, which is especially towards the evening. He likes to take the cold drinks, but he gets the symptoms. So with all this, with the acidity, with the asthma, acidity inducing asthma, with the periodic affection of the cough, with the nature of restlessness, with the nature of anxiety, with the aggravation from the cold, with something deep, fatiguing cough, with this aggravation at the night, when we put the totality. So totality, like again, I could say that according to Kent's repertoire is a book where we got a lot of drugs in it. Homeopathic drugs are grouped. So if I tell like anxiety means we'll have a lot of drugs in that. So if I tell anxiety due to fear of his disease, or anxiety while thinking of the disease, the drug starts changing. Okay? And then when I tell like he has got a very sternest pain in the chest, there will be a lot of remedies. But if I say stitching pain in the chest, only inhalation leads to that pain. So those kind of things, again, the drug will start changing. So now this case, the male case, only 3 years of history is there. And we no need to go to a deep acting remedy like calcareous carb. We can go to drugs like arsenic album, which is a psychotic remedy, which will take care of his lung before going into bronchiectasis or before going to a emphysematous condition.
Thank you, Preena. I think we can see if we can get some feedback from Harish ji. But before you do that, I just want to put one in the chat box. I put here Kent's repertory.
Yes,
this
sir.
is a
yes, sir.
very, very important book, and it has I don't know, it has a lot of details. I've also put in a comment about from HomePath Zomeo. Is a software with a compilation of resources to help students and practitioners with all these repertories. Now, I feel that many of the qualitative parameters that you describe will be comparable to modern medicine descriptions and also with the Ayurvedic description. So there are many terms you have used, and I can see that, you're drawing in the psychological, the mind aspect into this. You're drawing in some other symptoms, qualitative descriptors, and you are putting it all together and then looking through the Kent's or other repertories, and to come up with a. Now, I don't know if Harish ji is happy with this answer. Harish ji, before we go to Swagat for the second question.
Yes, sir. I am still learning. Actually,
Acha.
I have no knowledge about homeopathic medicine. I want to learn more about homeopathic medicine. But there are 2 points, sir, about homeopathy. One is, as you rightly mentioned, is there any possibility to develop homeopathic medicines? Like we are choosing Ayurvedic medicine, say Boswellia serrata, we can decide on the we can choose it on the basis of diagnosis. So in homeopathy, I think they are not choosing the medicines according to the diagnosis. They choose according to the symptoms of the patient. So please teach me about this. What is the criteria of choosing a homeopathic drug? And second is how the potency is chosen,
Right.
like 200x or 1 m or 30x. What is the criteria? Thank you, sir. I'm a student.
Yes,
Wonderful, Harishji. I'm so happy you asked this because Prinaji is the correct person to give us some insight into this.
yes, sir.
Prinaji, could you do this very quickly because you have got Harishji excited about homeopathy.
Yes, sir. Yes, sir.
And secondly, the important thing is how you do your examination. I think this is Harishji's question.
Yes.
How do you do your examination, and how, Harishji, I put one pointer here, which is pointing to the Government of India's National Health Portal. And it talks about the principles of prescribing in homeopathy. And homeopathy is always right in saying we treat the patient and not the disease, which is very much like in Ayurveda too. And then they also talk about how they prescribe. 12 types of prescriptions are there, and that is a very special thing within. I leave this to Prinaji. I hope Swagatji is still here with us. Swagatji, you are also here. Please wait because we want your.
Sir,
Yes, sir. I am just about to move. I'll complete my answer and move.
Okay, in which case we will take, while Prinaji thinks about how to address this question, we take the answer from Swagatji, please.
Yes, sir. I hope there are two questions for me. One is it Kamakashwasa is considered as asthma? Yes, it is Kamakashwasa. And the thing what you treat on the basis of the anti-inflammatory drugs. Yes, we do also treat with the anti-inflammatory drugs. Like Haridra, that is curcumin, what they use, is the same thing what is being used here also. The best treatment what we used is Haridra di Dhumapana. Haridra Dhumapana, which is an excellent treatment. Just plain Haridra Dhumapana, which has got a wonderful result with respect to spirometric analysis, which was done, and research was done in the year 2004. Spirometric analysis with compared to Haridra Dhumapana. And there raises a question. What is the question is how the Haridra Dhumapana, we consider Dhuma itself as one of the etiology, and how the Dhumapana is as a therapeutic effect. So it is that like once we are having an Lekana only the effect of the treatment. So that is, I will not go in detail with that.
Swagatji, could you, sorry, you got cut off in between. Please, could you repeat that last part again? Haridra Dhumapana.
Haridra Dhupana is also one of the etiology, Dhuma. And Dhumapana, how it is a therapeutic effect, is a bigger question. Many people get it. So, a person when there are fumes,
we have lost.
When there are fumes,
please.
Yeah, really I'm getting calls, so it is getting distracted. When we get fumes in the kitchen, fumes of the chili, it is so exacerbating that the person will continuously cough for more than half an hour irritated. And the irritation of the ghee is so mild that he won't get anything. So here in Haridra Dhumapana, the irritation in the bronchioles is to such an effect that it only scrapes out the mucus present and it acts as an anti-inflammatory. That is the best target-specific treatment which we can adopt. That is Haridra Dhumapana. That is one of the best target-specific treatment and anti-inflammatory drug. And
thank you. Thank you. I'm putting, I know you are rushing somewhere, but thank you for mentioning this Haridra Dhumapana. I've found one reference.
I'll complete one more question, sir.
Please.
The last question was bronchiectasis. Yes. Bronchiectasis is not Kamakashwasa exactly. It comes to the understanding of the Urakshata. Because there will be some hemoptysis. There is Urakshata, wherein we treat with the Swasakata Rasa, which contains arsenic, the purified form of arsenic with other drugs like Talisa, Vasa, and all. We treat that, and we have got wonderful result with SC Madhu and Godanti in case of hemoptysis. This is what I would like to comment, and as I'm in a hurry, I would complete this.
Thank you,
sir.
Swagaji. Thank you. We will come back to you. I think Harish ji will come back to you on this thing. I think Nishant, please.
Permission of Dr. Swagat sir, I would like to show the presentation of G.S. Srinivasacharya sir, where his face is there in the same Dhumapana picture.
Oh, please.
I will be sharing it.
Sure.
Sir, with permission of Swagat sir.
Sure.
Sir, can you see this? So this is a single night clinical study where it was carried out, and sir was mentioning about the pulmonary function test analysis that was done here. So this was the result that was projected in that particular clinical trial, where the forced vital capacity has been increased. Then comes the peak expiratory force rate that was also increased. The forced expiratory volume for 1 second was also increased. This is FE1 and FVC ratio that was also increased. So this was the result of that particular Dhumapana that Swagat sir just mentioned, sir.
Nishant, is this result published or is it still?
This is a clinical research from the Rajiv Gandhi University of Health Sciences, sir. This is a research project.
Is it published or is it still not? Do you know if it?
This is as a part of the post-graduate thesis work has been done, sir.
Who was the author of this thesis? Do you know?
Not sure, sir. I'll.
It'll be wonderful if you could.
It is Pradeep. Pradeep is the author, sir. Main author is Pradeep, and guided by Dr. Srinivasacharya.
Thank you.
तो इसमें सर ingredients क्या रहते हैं? What are the ingredients of धूम्रपान? This.
Oh, yes. I think who wants to answer this? I think Nishant, you want to answer this? What are the ingredients in this Dhumpan in your?
Haridra and Grita, only 2 ingredients.
Oh, okay. Haridra and Grita.
What is the ratio, sir?
Sir?
What is the ratio? Like
there is a Varti is prepared. Preparation method is Varti is prepared from the Haridra Churna.
Okay.
And then it is dried up and it is mixed with cotton, rolled off, and it is then after drying it, then we are giving it in the form of Dhumapana.
Sabash, thank you. Harishji, this is a fascinating suggestion. Swagaji, you're given us, I'm so happy you are here today to share on late Srinivas Acharyaji's birthday, and to share with us such amazing insights and wonderful studies that are completed. So thank you to you for sharing this. I know you are in a hurry and rushing away. Thank you, Swagaji. And thanks, Nishant, for sharing that the results of that study. I put a note here, study completed by Pradeep under the supervision of late Srinivas Acharyaji. Thank you. Harishji, I hope we can now come to Preenaji for that question about
Yes.
I think Preenaji will take us through how they do for want of a better word, I'm going to use that Ayurvedic term, which is Roga Pariksha plus Rogi Pariksha. How do you do this, Preenaji?
Yes, sir. So in homeopathy, as I said earlier, we treat the person. We don't treat the patient inside that. We treat the person. So when we are taking a case, or when we take a case taking, first we take the presenting complaints, history of presenting complaints, everything we take. But in the second half of the case taking, after the examination, what we do is we take first the common symptom, the uncommon symptom, and then we start analyzing it. Then we put the totality. So in this totality, so totality is like depending on the case. If I'm taking a case and in that case, if the mental symptoms are more, I go to Kent's Apathy. So Kent is a person who gives more importance to the mental symptoms, and I go to the mental symptoms and I take Kent's Apathy and I do it. Some cases that Kent's Apathy When we do a repertorization, the repertorization helps in chronic case taking because they have a lot of symptoms. So like if there is any pathological condition, pathological changes means we go to a particular repertory called as Bonnie-Husson's repertory. So Bonnie-Husson's repertory deals with a lot of pathological changes, pathological conditions, all those kind of things it goes. But nowadays, that all was during Hahnemann's period, but nowadays we got lot of clinical repertories, we got modern repertories, we got computer repertories. So these clinical repertories, we call it like a Murphy clinical repertory. So in this repertory, we have got the direct diagnosis itself, even though in homeopathy, we don't go based on the diagnosis. We never give importance to diagnosis. We just go based on the person who is having the disease. But certain kind of acute conditions, or when there is a cancer of third or fourth stage of cancer, we can't go for a case with a mental general, physical general. So those kind of conditions, we take up different kind of repertories. So with the diagnosis, homeopathy never goes. We just take the mental generals, physical generals of the patient is the first criteria. The grade 3 symptoms we call it. So if I'm taking a case and my case doesn't have a mental general, physical generalness, I have not got into the case. I have not taken the case properly. My case should have a will and understanding of the patient. My case should have memory of the patient. My case should have intellectual status of the patient. So I should take all this. I have to analyze. So I analyze the case or I analyze the person when he is normal in condition. So this kind of constitution, this kind of diagnosis, a person with this kind of temperament is getting this disease. So what will be the drug? So we call this totality. So the totality is this constitution and the drug which is proved according to this. So when I tell anxiety here, that drug also should have anxiety. And when I tell anxiety due to this illness, the drug also should have anxiety due to illness. Not all the drugs will have those kind of things. And I put grade. Now, if I see like in 10th repertory, if I put anxiety, illness from this, we'll get some 50, 60 drugs. But I have to particularize, I have to characterize the symptom. Why this anxiety is. So I tell this anxiety started after the family problem, after the issue from his child, after the child betrayed him. So those kind of words I use, I take it in the repertory and I catch the drug over there. So homeopathy doesn't go according to the diagnosis, it goes according to the constitution of the person. So we individualize the case, then we go for the similarity with the help of materia medica and repertory. This is the first thing. And the second thing, sir has told about the 12 prescriptions. So 12 prescriptions, we all know we have got acute case, we have got chronic case. So now when talking about bronchial asthma, whatever we have discussed today, when we talk about that, bronchial asthma is a chronic disease. We know there is a constriction, we know there is narrowing, we know there is a hypersensitivity, everything. So this, when he gets first time, second time, we call it acute. When it goes for more time, we call it as chronic disease. So when it goes for chronic disease, I have to take the constitutional remedy. But when it is like first type of prescription is acute prescription. First type of prescription is acute prescription. So acute prescription is, we know acute diseases where there is acute onset of disease, where the symptoms are very rapid, they are self-limiting in nature. So example, the pandemic you can take. So in this pandemic, the government has told the homeopathic prescription will be arsenicum album. So very acute. So now we can think why I told bronchial asthma, I told arsenicum album. Now for this COVID also, I say it is arsenicum album. But COVID, what sort of symptoms we had? We had allergic, we had rhinitis, we had sneezing, we had throat pain, we had chest congestion, and severe cases even landed up in pneumonia and various complications we had. So if you take the drug, if you go into a materia medica, if you take a drug, we can know that arsenicum album has got certain points related to acute also and certain points related to chronic also. But the difference is I differentiate with the constitution. So when I'm justifying myself to you, I say I took arsenicum album because my person has got this mentality, because his physical general is like that, he likes cold food, but he cannot assimilate it. He get acidity because of that. Not every person who takes a cold food and he get acidity, but asthmatic album patient, he will get it. And Naxwamika patient means he's very, another drug, Naxwamika. He's very arrogant, he's very bossy in nature, and he gets acidity because of that nature. So the first one is acute prescription. So acute prescription, we may need it in many group of people. Next one is etiological prescription, the second one. So etiological prescription is when we know the cause. When we know a cause. So when we know a cause, now we know, okay, food poisoning is the cause of the disease. Because of this food poisoning, only this many people are affected. So I say, like, whether this is spoiled food, or whether it is a cold food, or whether it is a preserved food, or whether it's an acidic food. For each and every cause, the drug starts differentiating. Or I go like, because the person, he took acidic food and he got nausea, one person would have got nausea, another person would have got vomiting, another person would have got diarrhea. So the drug starts differing in each and every case. So that is due to the etiology. Next is keynote. So keynote is each and every drug has got a keynote. Now, like if I tell Asricum albums, he has got burning sensation all over the body. So that is a keynote for Asricum album. And if I say another drug, Ipetorium, I say that he has got, he feels as if his bones are broken. So I tell it is Ipetorium. So fever, when a person says, I feel my bones are breaking, I've got severe body pain. So I tell, okay, this is Ipetorium case. And if I tell, I have got fever, I got cold, but I'm very tired, means I go for Asricum album. If I say I have got fever, I'm very tired, I don't want food at all, but leave me alone, means I go for Bryonia. So I characterize, I change my prescription according to the constitution, according to the keynote, the word difference. In each and every word difference, our prescription starts changing. Next is constitutional, which is very standard of homeopathy, mental, physical, and particular symptoms. And
Prina, thank you.
yes,
Thank you so much. I think you have given us a very good idea about the first three and the remaining ways in which, and this has been very educational because you have given us a very detailed description of repertorization. And that has been always something that I could never understand, but now I see that there are about 200 different types of repertories which are available for homeopathy.
Yes, sir.
And the second, and the second thing that came through very clearly today is the 12 types of prescriptions, you know, palliative, tautopathicc, synthetic, pathological, etc., etc. I put that in the chat box, Harishji, and I want to thank you because I'm just looking at the time, we are coming up to 8:30 now. We will, Prina, number one, we want to thank all of you from the community, from the homeopathy community, for teaching all of us some of these things, some of these issues about how you do your case taking, how you take the holistic measure for the patient. What is still not clear is at what point does your decision tree, you're doing a decision tree, when do you start to emphasize more on the mind or more on some other symptoms? And how do you decide? These are all longer questions. We will leave this here, Prina, for the moment, but I'm hoping, Prina, that you will be a very important part of our platform when it comes to homeopathy and discussions in the future. Harishji has opened up that question very nicely today, and he has, pulled out some very fascinating replies from yourself. The only thing I would suggest, if I may, is that we need to extend this dialogue. We want to extend this dialogue between the Ayurveda people and homeopathy, between Siddha and homeopathy, between modern medicine and homeopathy, and compile these results. I don't know if Father Mullers has a database with all the patients they are treating in their hospitals and what outcomes are there. And maybe it will start to become a learning experience for all of us at that level. So Prina, we are looking to your guidance and help and a central person in our platform in the future. So number one, thank you so much for answering those questions raised by Harishji. Very, you have introduced us to those kind of questions, to how to look at the problem, how you homeopaths think about the problem, and how, secondly, what are the resources, prescription types, how you reason, and repertories that are available, how you use them. We have a lot to learn from you people. So thank you, Prinaji. Please stay with us, because as we come very quickly to 8:30, I want to see how Pavanji is for time. And before I give the floor back to Pavanji, I want to thank Nishant. Nishantji, thank you so much for taking us very deep into so many aspects of asthma, and finally showing to add to that Haridra Dhumpan protocol that you gave us. And thank you for pointing us to that study conducted by late Srinivas Acharya. And for Swagatji for reminding us that today is the birthday of late Srinivas Acharya ji, who we miss very much. So with those few words, I pass the floor back to Pavanji so that he can tell us whether we have more time or whether he wants to take it forward. Pavanji, namaskar.
Time is yours, sir. Stage is yours. Time is yours.
No, I know.
No limit.
Because today we are hitting a very important point.
Excellent, sir. Means unique event.
Yes,
event.
very amazing. For me, this is amazing because I can see then when Swagatji mentioned about Dhumapan, Haridra Dhumapan, Prinaji was clapping. Prinaji, I want to ask you, why were you so excited about what Swagatji mentioned? Because you were so excited and you were clapping your hands to what Swagatji mentioned and what Nishantji mentioned. Could you tell us why you found it so exciting?
Myself, sir.
Because when Nishantji was talking about that special Dhumapan procedure where they use turmeric and use it for managing some subtypes of asthma, I could see you had reacted to that comment there with the hand clap. Was there a special reason? Preena? No. Harishji?
Yes, sir. I found it new, sir.
Okay, you found it. Now, Preena, what I find difficult I'm repeating that question I asked earlier. You are in Dakshin Karnataka, and you are in Mangalore.
No, sir.
Not far from you is SDM Hassan. SDM Udupi. My apologies. I don't know what is the distance between Father Muller's and SDM Udupi and Munial College. I don't know how much distance there is between these institutions.
Actually speaking, I'm in Chennai, sir.
Oh, you are in Chennai. Sorry. But you studied.
Yes,
You studied in Father Muller's. What is the distance between Father Muller's and the Ayurveda College and the Ayurveda institutions there? The reason why, and also Manipal has the Modern Medicine College with the Ayurveda department. My question, what I'm trying to get to, Preena, is that we need this dialogue between the different disciplines.
Yes, sir.
Because we can all learn so much. We have today in this event, we have learned the elegance of prescriptions, 12 types of prescriptions. We have learned the elegance of your repertorization as a procedure, how you do the questioning. And I think we can all learn from each other here, and we want to see how to make this happen. We want to see how, because there is a new center that is coming up in Jamnagar, as you well know, the WHO Center for Traditional Medicine that is coming up in Jamnagar. And we are trying to see how to make this center that has come through with a lot of discussion in the global platform, how to make this a very special place, how to make it something that the rest of the world could not have. And I feel what you have offered today is a continuation of our talk yesterday. And I want to highlight just one section from this slide as soon as it comes up on the screen. It is this section here. If you can see my cursor, it is about Ashish Kumar, Chief Executive Officer of Wilmar Schwab, India, a leading firm in homeopathy medicine, said, we can't compare with the chemical or allopathy industry because the trials for a product run for hundreds of years, for years. Homeopathy has about 20,000 products, including mother tinctures and so on. For each product, if you ask for trials, neither the Ayush industry nor the government can do it. So there is a need for certain efficacy demonstration studies, which will be a combination of qualitative and clinical aspects. So you see, this is being put in the context of this center in Jamnagar. And we want help from experienced people like yourselves to take us into that space. And for all I know, this might be the first time we are having such a detailed discussion with senior physicians like Harish ji joining us from Toronto, Swagat ji joining us from Agra, yourself and Nishant ji joining us from Karnataka, yourself joining from Chennai. It is such a delight to see this happen. And we are touching on some questions which are identifying those commonalities between all of these disciplines, you see. And no other country in the world has this level of intensity possible. India is the only country that has this diversity. China has Chinese medicine. Japan has Japanese medicine. Korea has Korean systems of medicine. But India has all of these things. We have Ayurveda, we have Siddha, we have homeopathy, we have naturopathy, we have Tibetan medicine. All of them are following a similar logic of treating the patient and not the disease. And we have modern medicine that wants to treat the disease and doesn't worry too much about many aspects of the patient, you know, the patient's mental state and prakriti and sattva and all these aspects. So I feel our platform today gives the world an example of how all these modalities can come together in discussion and learn from each other. This is my take on today's. So I want to thank Preena ji, I want to thank you so much for pointing us to some of these things. And I want to thank Harish ji in Toronto. Harish ji, before Harish ji, I just want to introduce you to Preena ji. Harish ji is studied Ayurveda in Punjab, and he is the gold medalist from Punjab University for Ayurveda for whichever year he was. So there is Harish ji, and there is Preena. Preena, thank you for turning your camera on. Harish ji, question from you.
Thank you, Preena ji. Dr. Madan ji, first of all, you asked about the students are asking for the ready reckoner in Ayurveda.
Oh, please.
The similar question was in my mind when I was a student of BMS in 84 in final year. And at that time, I wrote a book, small book, which is based on modern diagnosis and Ayurvedic treatment. This is a comprehensive book of Ayurvedic treatment. And if you will see, here I have mentioned bronchial asthma, and in bracket, tamak shwas, then the symptoms according to Ayurveda, then the treatment with the pharmacopoeial preparation, various treatment like Churan, Vati, Asa, Varist, and all this. So this effort I did long back. But now coming back to today's point of bronchial asthma, my prescription remains in bronchial asthma, I generally choose 3 medicines. One, anti-inflammatory, combination of boswellia, curcumin, and glycyrrhiza glabra, mulakthi, haldi, or salai gogar. 3 दवाइयाँ, बहुत effective. And second part उसमें जो anti-allergic जो आजकल नई एक classification आई है medicines की, we call it leukotriene modifiers.
Leukotriene modifier.
उसमें शिरीष is very effective. जो शिरीष बीज हैं, they are very albizia, Albizia is very effective. And third part उसमें जो आयुर्वेदा की ब्यूटी है, immunomodulator and rasayana. When I was in India, I was choosing Shwas Chintamani Ras with Pipli. It was very effective. And I mean, I treated many patients, rather I cured many patients. Rajan ji इसके बारे में ज़्यादा बताएंगे क्योंकि for long I am not using rasa preparation due to binding in West. So ये तो पॉइंट थे आज के बारे में. लेकिन एक मदन जी आपने जो पॉइंट कहा कि होम्योपैथी आयुर्वेदा इकट्ठे मिलके चले, वो हम मेरा मानना है होम्योपैथी के प्रिंसिपल्स डिफरेंट हैं. होम्योपैथी इज बेस्ड ऑन, मुझे वो लाइन याद नहीं है, डॉक्टर प्रीना जी बताएंगी, जिस दवाई से बीमारी बढ़ती है, सिमिलर समथिंग लाइक दैट, जो इनका प्रिंसिपल है. तो जैसे फॉर एग्जांपल गार्लिक है, वो गार्लिक हम लोग आयुर्वेदा में गार्लिक को यूज करते हैं वातनुलोमन या पाचन, दीपन पाचन इस एंगल से. लेकिन होम्योपैथी में गार्लिक को एज एंटी ट्यूबरकुलर मेडिसिन यूज करते हैं या इस तरह का कुछ. तो होम्योपैथी की एप्लीकेशन मुझे लगता है टोटली डिफरेंट है फ्रॉम आयुर्वेदा. तो इसके बारे में थोड़ा सा प्रीना जी बताएं कि कैसे हम प्रिंसिपल्स को इकट्ठा कर सकते हैं. थैंक यू सर.
Thank you, Harish ji. This is an open question. Preena ji may not be able to. Preena ji, could you understand the question? Harish ji was asking in Hindi this question. That
garlic in Ayurveda is used for acidity. But
no, garlic is used. Harish ji will explain where they use garlic. Garlic is used differently. So what Harish ji, Preena ji, what Harish ji is saying is there is a fundamental difference between the logic of Ayurveda and Siddha and the logic of homeopathy.
to my knowledge, I know the difference is there in the preparation of the medicine.
The preparation
of the medicine, we know, because we use more of potentized medicine. We don't go for any whatever is there with the mother tincture we do have, but we are according to our philosophies, we don't use that much of mother tinctures, but we go for what I can say is potentized medicine. But now we do have the drug like Avina, I think the garlic, suddenly I'm not getting the name of it. We do have the drug, and we have got something like call it as a keynote prescription, or we call it a red line prescription we have got. So in that, we can see that now various studies goes on. In that, we can see that the characteristics of that particular source. So now if I tell a drug name, Chionanthus, if I tell. Okay? So Chionanthus is a drug, when you see the history and all, we can see that they have given for gallstones. So the history is that. So when we prove that Chionanthus in an extract, and when we give to the patient, we see that biliary colic is reducing, cholesterol is reducing, we see that liver complaints are better. So we give Chionanthus. But when we go to study, now various trials are going, various studies are going. When we see that, when we analyze it, we see that Chionanthus has got some alkaloids in it. That alkaloids has got a impact on the cholesterol level. So this acts as a reducing for the hypercholesteremia. So it reduces the gallstone. Now we do studies and we bring it here. So a drug, whatever we use, if a drug we use also, the ability of the drug, whatever we say in Ayurveda, so that to my knowledge, I have discussed with my friends also, the drug would be used for that. In homeopathy also, in the potentized form, we too use in that. Because in our thing, when we prove a drug, we don't quantify to one symptom. From mentals, from mind, from eyes, face, nose, mouth, ears, chest, throat, and the male and female reproductive system, abdomen, lymph, everywhere the action is there. everywhere. So when we compare, so for example, in this platform, we can compare any two drugs and see whether the same, because we may call it in a different name. The other disciplines may call it in another different name. So when we compare it and see, we can see that, okay, whether there is any quality. The basic difference is preparation of the remedy. So preparation of the remedy is that we do potentization. We don't take the now they call the nanoparticles, like we go in that way. So when you check our dilution, you cannot get like the garlic in its same form, but we can have the quality of that in a medicinal form. Medicinal means potentized form.
You know, Preenaji, thank you. This is a long discussion,
Yes, sir.
because you have used another very exciting word today, which is provings. And this is, we in Ayurveda, Siddha, naturopathy people don't understand what you mean by provings. They don't understand what you mean by repertories, repertorization. They don't understand what is meant, how you choose the one of the 12 types of prescriptions. So these are principles, but there are commonalities and there are small differences. But I think if we sit together and start to discuss these things and learn, you know, you will not understand, homeopathy people might not understand Panchakarma. They won't understand any of those terms like avarana, for instance. So there is a need to sit together and just, like what Harish ji is saying, and like what Nishant is offering us today, if we just come together and sit together and do a small brainstorming, then we can see those similarities, we can see those differences. But there is one big similarity, which is homeopathy talks about the vital force, and Ayurveda and Siddha talks about prana, and the Chinese medicine talks about qi. So there is, at the deep level, there is a very big commonality. But then as we come out and we come to different ways in which the systems are used, there are differences. So we can look at the differences and say these are differences. Now I want to bring Rajan Patankarji, who is here with us from Mumbai. Rajanji is here. Rajanji.
Namaskar, namaskar.
Namaskar, Rajanji. Rajanji produces something called Sukshma Aushadhis, you know, and he uses some of this combination of Ayurvedic principles along with homeopathic methods to arrive at some formulations that is used by a Ayurveda person. Rajanji, please.
हाँ, नमस्कार, नमस्कार. बहुत सारा डिस्कशन सुन रहा हूँ, क्योंकि क्लिनिक में हूँ, इसके लिए पूरा सुन नहीं पाया. पर जो अभी हरीश जी ने एक जो पॉइंट रेज किया था कि वो अभी वहाँ पे रसकल्प नहीं यूज कर सकते हैं, तो श्वासकाश चिंतामणि तो बहुत अच्छा काम करता ही है अस्थमा में. पर अगर आयुर्वेद के तरफ से देखा जाए तो अस्थमा के लिए अगर उसको पूरा क्योर करना है तो our senior वैद्य वैद्यराज जोशी जी from Dhulia, he used to give Vaman. So after taking Vaman, in 2 cycles and in the same Rutu, Vasanta Rutu, that definitely helps the patient. And only on that Vaman, he has developed a very modernly equipped hospital in a village like Malegaon, and that was supposed to be the only and only full-fledged Panchakarma hospital which was run by the municipal corporation of Malegaon. So only one and one. And as per my experience, the Mashi Kalpana, that is the threads of coconut, if you burn them and at the time of asthmatic attacks, if you administer in equal quantity with sugar, that helps a lot, and it is more effective than any other derifylin or any pump. That is 100% effective, and I had used in hundreds of patients. Then another thing, as Harishji said, apunarvo chikitsa. So for that, Kushmandavalya is most effective for that apunarvo chikitsa. Then, as you said, Swaskash that type of medicines which I am preparing, that is nanomedicines, it is the base of that medicine is Ayurvedic. But as per the law of Ayurveda, Mardhanam Gunavardhanam. So we triturate in lactose. So by triturating in lactose, the effect of the medicine has raised by 4 times. It is easily acceptable by children also, old age persons also, easy to carry, easy to administer, and the absorption start right from our tongue buds. So another thing I want to share, in asthmatic patients, I use Tailapan, and that is Bala Taila, the tail of the one plant called Bala. It helps a lot because I had advised one patient whose lungs have been collapsed 95% and was advised to transplant it, but the patient got cured, and now a female was there and she has got a 2-year child also because her lung function was raised up to 90%, not 100%, but by only administering Bala oil, that is Tailapan. And I also advise to apply Bala oil on the chest and on the back. And after that, take a hot fomentation. It also helps a lot. And as per Ayurveda, the Agni is most important. So Shunthi also helps a lot. Shunthi Siddha Jala or Shunthi with Ghruta to increase our strength of Agni. And that will also help a lot to arrest that asthmatic attack. So thank you very much, because I couldn't listen it throughout the day, means throughout the time, but definitely I will listen on YouTube and give my feedbacks also. Thank you, Madanji.
You will enjoy Nishant ji's presentation because he talked about Satyavamana and all these things in his presentation. A very, very nice presentation. So Nishant touched on those points.
Definitely.
Nishant ji was also very good because he told us a little bit about Ritu Sandhi Kala treatments, and then he pointed very specifically to Ritu Sandhi based aspects. So you can see some strengths are there in each of the modalities. Ritu Sandhi is very special to Ayurveda, and he showed us one table where he shows the different, how you go through the 14 days of the Ritu Sandhi treatments. So there are strengths in each of these systems. There are strengths in our traditional systems, and we have the expertise in India, like Preena ji, Harish ji, who have clinical experience. They are getting amazing results, like yourself, like Nishant ji. I think this is the strength that we have here as a community, and that Pawan ji and everybody else has made the platform for, so that we come together, we share these things. Our Siddha colleagues are missed today. Our Unani colleagues are missing today, but it doesn't matter because they have been with us in earlier sessions, and we have learned so much from each of those sessions at every occasion. So Rajanji, thank you so much. I have a question before you go away, Rajanji. When you do titration in protein, lactose, how dilute do you make this?
Okay.
How many?
Means, to prepare the base, means if you take 1 gram of any rasa uchadi or any rasa kalpa, we have to triturate in 1 gram of lactose, and that is for 3 hours. Means that will be, we call it as a base. Then after adding, because I use only 2 eggs in this form.
2 eggs.
Yes, 9 times of the original medicine, that will be 1 egg, and again 9 times, that is 2 eggs. But that should be triturated 300 to 400 times. It is also beneficial. But the base is to be triturated for 3 hours. That will be approximately 2000 times.
Thank you. I know you have done in YouTube, there are some of your presentations about all this, which you have done for Ayush Darshan for their program. But maybe we will come together again to learn a little more about the specifics of how you, because how you prepare something similar to the mother tincture. Then in homeopathy, you are doing something similar, and then you're diluting it a little bit to give.
Definitely, definitely. Yes.
Thank you. I raised this point because Preenaji is here with us, and she can listen how the Ayurvedic community is also using some of that homeopathic dilution approach.
So that's why we called it as a Sukshma Aushadhi.
Thank you, Rajanji.
Yes.
Very happy that that we are here. I can see Harishji might have left us, but he's left a message here saying, excellent discussion. I shall follow on YouTube. Preenaji, thank you very much. Nishant, thank you so much for sharing so much valuable information with us today. And I can see Rampalji is here from Rajasthan. Rampalji, namaskar. I don't know if you would like to say something. Nishant, would you like to make some comments as concluding comments on today's event? And I will also request Preenaji to do the same before we pass the floor back to Pavanji. Nishant, concluding remarks about today's event, whether...
As you rightly said, sir, the collective information from all the sides to conglomerate and come up with ideas that can be really have the practical implications. So this is where the patient has to get benefit.
Thank you so much. You are the next generation, Prashant. We are looking forward to you to keep this, to put energy into this platform. Thank you for joining us today. Number two, we want to keep this leadership position, because India is now presenting in Jamnagar. We have the Global Center for Traditional Systems. And we want to see how we can take whatever strength we have in India and put it into that center so that it becomes a very, very special resource, not only for India, but for the whole world. And it will require many decades of work, and young people like yourself will be central to this whole activity. Yourself and Preenaji. Preenaji, last words from you, please, because this has been a very exciting event today. We started with asthma. We have come to the parallels between different systems of medicine. We are pointing towards where India can take a very big leadership role in global thinking for helping the patient and helping the community. So, Preenaji, floor is yours. Concluding remarks before we pass it back to Pavan.
This gathering is really new to me. I too learned a lot from it. And I'm very happy that I could share some points in regard to homeopathy. Like our Vishant sir told, like it is ultimately it is the whatever we do is for the patient. So we heal the patient in a simple better way. That's it.
Thank you. Thank you, Preenaji, because and we look forward to your help and guidance for this platform and for developing new interactions and discussions. I think Rajanji has a comment. Rajanji, namaskar.
Only one sentence, because as you said, in homeopathy, the lakshanas or the classical preparation or classical examples of medicines, it has been published in Ayurveda also. That is Vyadhi, Lakshana and Chikitsa Kosh by the very well-known Ayurvedic practitioner from Pune, Dr. Koletkar. In his presence, the work was done for 10 years, and that is Vyadhi Lakshana Kosh has been published, and it is available in CDs also or in book form also.
But is this in Marathi or in Hindi or in English?
Sanskrit and English also. Yes.
Thank you. Because you also in Pune, Mama Gokhale's Chikitsa Pradeep.
This was done by little bit later. After Mama Gokhale. That was Mama Koletkar who has done this, started his work, and was completed by Vaidya Gadgil, then Vaidya Dhananjay Kulkarni, and so many followers of Mama Koletkar Parampara.
Mama Koletkar Parampara. Thank
Yes.
you. Thank you, Rajanji. Thank you. Because out of these discussions, we are learning so much that is available in each state. Before I give the floor back to Pavanji, I just want to share a little bit, one screen here, and this screen is with Father Muller's. Bear with me. This is just to point you to Father Muller's website, and that is a very fascinating institution. And Father Muller's is one of the most respected Ayurveda education institutions in at least the south of India. I don't know about how it connects with Father Muller's. Bear with me. So, and just for you people to understand the scale of the Father Muller group of educational institutions and hospitals. Across Karnataka, they have so many institutions, just like the SDM group of institutions. And Father Muller's, I just want to pull up this screen just to show you the scale at which the Father Muller education hospitals, education and hospitals work. And if you can see my screen, you will see how systematically they have worked on. Okay, here we are. This is Father Muller's homeopathic. This is where Reena ji studied, Father Muller Homeopathic Medical College. And if you go to the bottom of this page, well, they announce their achievements, their students who have won medals, etc. And now here, look at these centers of excellence. So they have medical college, homeopathic college, allied health sciences, nursing, speech and hearing college, Father Muller simulation skills center, pharmaceutical college, and a research center. And they also have this whole collection of hospitals. Father Muller Medical College Hospital, and they have a leprosy hospital, de-addiction center, and other rehabilitation units, etc. The point I'm making here is, again, that the nation has such incredible resources. And we now have a WHO center coming up in Jamnagar. And somehow we must find a way to bring all this together. And our speakers today are pointing us to that possibility. Harish ji asked some questions. Swagat ji, sitting in Agra, has pointed us to some amazing things. Our old teachers, you gave us the Koletkar Parampara, Rajan ji from Maharashtra, and people from SDM Udupi talk about Srinivas Acharya Parampara, of which we have two people here with us, Nishant ji and Swagat ji, and what they have learned and what they have in their minds learning from Srinivas Acharya. And I wanted, the last word today is Srinivas Acharya ji's birthday, as Swagat ji has so said. We will miss him. He passed on last year, unfortunately, but we had so much more to learn from him. So our senior teachers, Oja ji in Pune has passed on, Begal ji has passed on. We lose people, but there are young people who are coming up who will hold that parampara together. So with those few words, I put the platform back to Pavanji. Pavanji, namaskar. Pavanji might be missing. Agnihotri ji is here with us. Agnihotri ji, namaskar ji. I know, Agnihotri ji, you are traveling. I think you are waiting for a, you might be.
Namaskar. First of all, I welcome you all in the holy city of world, India, and of course, Uttar Pradesh. This is Banaras city, and I was taking all the enjoyment of Banaras roads by bike, motorcycle, right from the station to BHU. Now we are standing in front of the BHU main gate. The Malviya ji statue is there. Malviya ji statue there, and we are reporting from the Kashi Hindu Vishwavidyalaya main gate.
Wonderful.
Entrance of Kashi Hindu Vishwavidyalaya, and we along
क्या
with
बात है सर, क्या बात. Salute आपको सर. Our webinar does not require stagnant situation.
this is the
Everywhere
idol of
mobile.
our Malviya ji. We took full time to reach by the time. So this is Kashi Hindu Vishwavidyalaya. And the fact is this, that as far as the today's webinar is concerned, I am most unfortunate. Neither I could attend full webinar nor the doctor to whom I suggested for today's participation. He was in doubt that he may be called at any time by DM because the meeting was due, but the time was not certain. That's why he came from Delhi to Morena. Anyway, but what I want to say is that after paying my full respect to all our seniors like Professor Bandhan ji, our Rajan Prathankar ji, Dr. Harish Sharma ji, our professors, all of them, that asthma was the only एक सिर्फ बेस. ये अस्थमा तो एक बहाना था. आज हमको होम्योपैथी जानना था. आज हमको प्रेरणा जी ने जो आंखें खोली हैं. We are not of homeopathy, we are of Ayurveda. So I was listening. I listened all her presentation after even up to Nishant. Even Dr. Swagat is also partially I took because sometimes the train was stopping. It was having signals, or I was having not signals. But what he told that the repetition, something of our it is sort of potentization, making as Rajan Prathankar was saying that sanskaro hi gunantara dhana or mardanam gunvardhanam. The way it has been pasted so many times, it gives a lot of say potentization of the so many medicines of decoctions we use as herbal. So Venaji's presentation was so good that the important factor was that how much she is learned. It showed that what is a PhD scholar is, or what does PhD mean. A person who has done graduation, post-graduation and PhD, of course she is scholar, she has written. So up to PhD level, one should be so sound. And so goes the case with our Dr. Harish Verma ji. Dr. Harish Verma ji, with all his intelligence, along with his full experience, always makes our discussion so vital that persons, those who may not be ready to answer, they are forced, they are compelled to come forward with the answer, and that makes our webinar wonderful. So, with all the geniusness of our Professor Madan ji, I used to be jealous that in simple one brain, how can these things may happen in any time? As far as the Ayurveda is concerned, Panchkarma is concerned, Nasya is concerned, any damn thing, you may be late to spell anything, but he gives full potential. Dr. Professor Swagat was talking about some Nasya, and Prinaji was answering. The fact is this, that we have got 8 times of Dhumrapan. Dhumrapan ke 8 ka बताया गया. And all these 8 times are the time where the phlegm, the dosha, kapha dosha is predominated. Resultantly, we go for the Dhavan, we go for Nasya Karma, we go for Anjan, and we go for Dhumpan. But there, Hariyanuka, Priyangu, Agar, Tagar, Agyaghas, these things are important. There is not a matter of smoke. The matter is of the contents from where the herbs are giving the impetus to the person who is suffering or generally having sneezing or allergic conditions. But as far as the bronchial asthma is concerned, that is stomach swab, with all the presentations, I still remember 2 things. The one is our चित्रकूट वाली खीर जो शरद पूर्णिमा को खिलाई जाती है, चित्रकूट अपना मध्य प्रदेश की, और दूसरा हमारा जिसमें कि हमारे जो निगम साहब ने उस दिन भी चर्चा की थी, राकेश निगम जी ने, हमारा वो कर्ण वेदन के द्वारा हम लोग 97% रिजल्ट है with some restrictions. So as long there is a bronchial asthma, stomach swab, it will work. Irrespective of the say dyspnea due to anemia, dyspnea due to worms infestation, dyspnea due to pulmonary coughs, dyspnea due to cardiac asthma. These 7 etiologies are of no value. The only bronchial asthma is that where the basa itself at the tota vesica, it's all prevention. Those can afford, they can go for the Swaskash Chintamani, Swas, Sangarabra. So many things are there, Som Chun, but in general, Putpak Vasa Suras is of great value. So as far as the Ayurvedic concerned, we are getting all information as our daily basis. But we were missing for a couple of webinars the information from homeopathy side. And today, Birnaji and our Nishanti, they made our
आवाज कट गया जी आपका।
प्लीज अनम्यूट।
आप धोखे में म्यूट हो गए सर। आप धोखे में म्यूट हो गए। म्यूट, काइंडली अनम्यूट।
अग्निहोत्री जी आपका आवाज कट गया जी।
काइंडली अनम्यूट।
कट गया। पवन जी ये देखो, रिपोर्टिंग फ्रॉम वाराणसी, फ्रॉम काशी। Sabash, wonderful. Agnihotri ji, आपका आवाज कट गया जी। I think there was a call coming.
रुको।
डॉक्टर साहब आपका आवाज कट गया जी थोड़ा।
अरे रुको तो 1 मिनट।
हाँ, आ गया जी, आ गया
सर।
आ गया।
कहाँ तो आई कॉल कहाँ है?
आ गया जी आवाज।
आ गया।
अरे रुको तो यार, फोन चला गया।
आपकी आवाज को रोक सके वो टेक्नोलॉजी में दम नहीं है सर। वेलकम। बहुत अच्छा रहा आज का।
I want to once again thanks, as Agnihotri ji says, Preena ji and Nishant ji and Swagat ji, you have, and Harish Verma ji, you have added so much to our event today. We want to thank again. Agnihotri ji, please. Agnihotri ji is taking us through Banaras.
5 और 6 को कोई दिन नहीं मिला सर मेरे को जो आयुष से रिलेट कर सके।
अच्छा,
यदि कोई 5 और 6 में कोई दिन ऐसा है जो हम आयुर्वेद से रिलेट कर सकें तो प्लीज गाइड मी। अदरवाइज 7th को वर्ल्ड एथलेटिक डे, अपना है सब्जेक्ट स्पोर्ट्स थेरेपी।
हाँ, we should get Srivaths ji will join for Thrissur, Kerala से आयुर्वेद स्पोर्ट्स इंजरी क्लिनिक वहां से।
बताइएगा सर। 8 तारीख को है मदर्स डे, 9 तारीख को हम मना रहे हैं थैलेसीमिया डे। So it's also on 8th, और fortunately we have got speakers on thalassemia also. Thank you for our all resource persons. And 10th is blank. If any day is there, please guide me. On 11th, National Technology Day. So new technology. Dr. Namrata Joshi from BHU, Dr. Animesh Mohan, Dr. P. Jarin, Prerna Jain. She is also with us. On 12th, I would like to have speakers from nursing staff, because International Nurses Day is there. Ayurveda, homeopathy, colleges have nurses. And what is the difference of their nursing care?
Very good.
It will be a unique subject. Nobody has focused on this. So I would like to request Nishant ji, Preena ji, Rajan ji, Jagdishwar ji, Agnihotri ji, everybody, please recommend nurses, senior nurses, retired nurses, who can guide us on what is the difference between our therapy. So up to 12, this is the program. Then on 15th, International Family Day, we have got various speakers. And then 16th, no day was there. Then also on demand, we have kept a unique subject, sir, practical aspect of Agni Karma.
Oh, wonderful.
Agni Karma, sir. There was no day. On 17th, World Hypertension Day, Dr. Swagat will also be with us. And from BHU, 2 persons will be there. On 18th, I need your guidance. Though Rajanji has recommended one speaker, World's AIDS Vaccine Day.
AIDS vaccine.
AIDS Vaccine Day. So if any international speaker can join on this topic, then we will be fortunate enough.
Thank you.
And then 20, unique day is there, World Meteorology Day. So we have decided topic for right dosage for holistic health. Because our Ayurveda is being defamed because we are not taking medicine or we are not prescribing medicine in the dose what was prescribed in our compendious text and sanhita. We are giving 2 tablets twice daily. That was not the dose of Ayurveda. 1 tola twice daily, 40 grams twice daily, 20 ml twice daily. So we are really undervaluing that dosage system. So Dr. Jerin will also guide us on that important point. Thank you. And on 21st, National Endangered Species Day is there. Excellent day. Then International Biodiversity. So like this, our journey is going on, sir. In blank dates, we can arrange any other webinar which will be suggested by our guardians, resource persons, speakers, whoever it may be. Please guide to have your local webinars. I would like to request Preena ji to have a webinar on Tamil Nadu. She is from Tamil Nadu. So we will be highly fortunate to listen about Tamil Nadu. Make its Ayush team. Don't worry. We have Karthikeyan ji with us. We have Preena ji with us from homeopathy. From allopathy we have Ayurvedic persons also. So please guide us your convenient dates and topic. We are ready to place the platform before you. Thank you. Madan sir.
Thank you, Pawanji. I think, Pawanji, this is the spirit of our platform is what we have seen today. And the spirit is that things just grow as we start our discussions. Our presenters today, Pawanji, I have just let somebody in, somebody named Anandji. I hope you identify Anandji.
We welcome him and we would like to listen him, sir. Dr. T.A. Anand.
Anandji, namaskar. T.A. Dr. Anand, namaskar. So the spirit of our platform is this, Preenaji, Prasanji, that Nishanji, that as we go into our discussions, we start sharing things, and what we are sharing leads to the next question and the next question and the next question, and it just brings people together. It brings a new energy into our discussions. Anandji, namaskar. Anandji, namaskar. If Anandji would like to share something.
Are we audible to you, Anandji? I welcome Dr. T.A. Anand. Kindly introduce yourself.
Please.
And please opine. Welcome, sir. Kindly unmute yourself.
Pawanji, we are looking to Preenaji and Nishantji for really adding energy to our platform. Just like Suhash Shettyji is behind us. Similarly, I'm hoping Nishantji and Preenaji will also be there with us to take us into the next and further levels of discussion. Nishant, we are looking forward to your guidance and energy to take us to the next level and to introduce more people to the platform and to bring and to guide us in this. And Preenaji, we are looking to you for all that aspect, not only homeopathy, but the state of Tamil Nadu also, so that we bring many people from whatever, all your friends from Siddha medicine, from Ayurveda, wherever you have, because I know your college also, your institution is also, as far as I know, has a Ayurveda college also, if I remember correctly. Yes. So Sai Ram Ayurveda College also.
Ayurveda Ayurveda, Siddha, and Homeopathy.
So if you can connect us with some of that, and maybe you can bring together that platform together, then we will appreciate this. I leave it with you. This platform is yours, as Pavanji says, and all we want to do is learn new things. We want to learn new things like what you have shared with us today. And we want to grow in our understanding and share it with people. So Pavanji, we are fast approaching 9:15. We have just passed 16 minutes past 9 o'clock in India. I'm sure we have, if there are no more comments, Agnihotriji, please. We are so happy you are there in BHU in Varanasi for your PhD, for the examiner, as examiner for a PhD thesis. We look forward to your stories, and we look forward to learning more about all these happenings in BHU. And Rajanji, thank you so much for joining us from Mumbai. And with those words, Pavanji, the floor is yours. You can draw this meeting to a close. Namaskar ji. Pavanji, thank you.
Yes, sir.
राजन जी,
पवन जी, जगदीश्वर जी कुछ बोलेंगे?
हमारे साथ है रामपाल जी. रामपाल जी से, I don't know how he cannot, looks like his microphone is not on or something. अगर रामपाल जी से थोड़ा सुने कि पशु उसकी तरफ कैसे करें, because there is a lot of, Preena, there is a lot of homeopathy that is used in the animal area also. And Dr. Rampal ji here was Deputy Director of Ayush in Rajasthan, a senior person, and he has told us in one of our Pashu Ayurveda events, he has given us so much valuable information. And he's here with us, but I think he's not able to share his microphone with us for some reason, but it doesn't matter. We know he's here. राजन जी, हमारी तरफ से बहुत बहुत धन्यवाद. आपने जो आज की जो मंच पे जो कुछ आपने लाया, और the magic in our platform, which is very special. Thank you, Pavan ji. And Pavan ji is there.
Thank you, sir. Thank you. जगदीश्वर जी कुछ बोलेंगे? तो बोल लिए.
Doma ji is very quiet. I don't know. Doma ji, namaskar.
नमस्कार सभी लोगों को. दादाजी नमस्कार. सब लोगों को मेरा विनम्र प्रणाम. जहां तक कि आपने हाथ में पड़ता है पेशेंट, सब जो है ना क्रॉनिक होने के बाद ही पड़ता है. नया नया कोई अप्रोच नहीं होता है आयुर्वेदिक मेडिसिन के लिए. दो चीज यहाँ पर आस्थमा के सब्जेक्ट पर आते हैं, तो एक पेडियाट्रिक का और दूसरा अडल्ट्स का. पेडियाट्रिक में नेबुलाइजर्स यूज कर करके थक गए. सो जब वो क्रॉनिक बन जाता है तो नेबुलाइजर का सिस्टम से ही मैं एकदम ऐसा मुझे अफसोस लगता है. फिर भी जनता उसके पीछे ही दौड़ती है अज्ञान की तरह से, क्योंकि नेबुलाइजर जैसा ही यूज करते हैं तो वहां पर जो स्पुटम या फ्लेम जो है ना, उसको एक्सपेक्टरेशन नहीं होता है, केवल डायलेशन, ब्रोंको डायलेशन होता है. लेकिन कफ बाहर निकलने से पहले वो अंदर ही जो है ना वो एंटीबायोटिक से सुखा देते हैं. उसका मतलब ये नहीं होता है कि चिकित्सा हुआ लेकिन रिलीफ हुआ, लेकिन बीमारी क्रॉनिक हुआ और क्रॉनिक हुआ. तो कौन सी ऐसी अभी जग गई ज्ञान जनता में कि वहां चिकित्सा हुआ या बड़ा. एक चीज रिपीटेडली जब जाते हैं, बच्चों को देखते हैं तो मुझे आंसू आता है. और ऐसे बच्चों को मैंने 7 साल, मैंने वो पैदाइश से 7 साल का बच्चा जो हड्डी बच गया इस नेबुलाइजर सिस्टम में, उसको मैं केवल रसभस्म दे करके, रसभस्म तो कोई तैयार नहीं करता. आज आंध्रा में ही पॉपुलर रसभस्म तैयार करने का, वो जो तैयार करता सब लोगों से खरीद करके मैं रखा हूं मेरे पास. और मैं बहुत कम, और तो काउंटर पे देता ही नहीं है, केवल मेरी प्रैक्टिस के लिए और आगे मेरे बेटी के लिए बना करके रखा हूँ। और ये जो रसभस्म का थोड़ी सी मात्रा में वो 7 साल का बच्चा को दिया, तो उसमें I think that I gave him 10 grams totally to use, but it should not be. लेकिन वो मांग करने के बाद बच्चा को देख करके मैं दे दिया। जब कभी तुम याद आता है एलोपैथिक का ऐसा इमीडिएटली रिलीफ होता, तो इससे आगे तुम्हारे को जरूरत भी नहीं पड़ता। वो बच्चा जो है ना 15 दिन के अंदर आया और आराम से जो है ना उसका चेहरा खुल गया और उसके साथ उसका भूख भी बढ़ गया। अग्नि तो अपने पास पहले ही बोला जाता है। तो ऐसा आज कोई रसभस्म तैयार नहीं करते हैं आंध्रा में, कोई कंपनी, सब लोग क्लोज कर दिए। वैसा है जैसा और ब्रोंकाइटिस के सिस्टम में श्रृंगी भस्म तैयार करना सब कंपनियां बंद करती हैं। तो अडल्ट्स के डोसेज में इनहेलर्स लेकर के इनहेलर्स करके वहां पर कौन सी ऐसा तरक्की होता है कंपैरेटिवली हम देखें तो वो भी क्रॉनिक बनने के बाद ही आता। अब जब क्रॉनिक बनने के बाद आने के बाद भी उसकी एक्सपेक्टेशन सिस्टम में मैं 2 विचित्र तरीका से देखता हूँ। एक जो है ना आंध्र भैषज रत्नावली योग से कि कफ केसरी करके एक दवा होता है, कफ केसरी को लवंगादि चूर्ण में मिला करके उसके बाद जो है ना अदरक रस में देना पड़ता है। उसका एक सिस्टमेटिक माने आनपान द्रव्य का ऐसा डिफरेंट तुम्हें रेफर करने के बाद वो जो इस्तेमाल करते वो आसानी से एक्सपेक्टेशन करता और ब्रोंकाइटिस को भी कंट्रोल करता सिंस इट इज अकम्पनिंग विथ लवंगादि चूर्ण। एंड जब अदरक रस में दिया जाता, अदरक रस में अदरक को संस्कृत में कफहरी करके भी बोलते हैं। आज मैं फिलोसॉफिकल आनंद मार्ग लाइन से वो रखे से मैं देखा हूँ, पहली बार देखा हूँ, वास्तव में मुझे भी याद नहीं है, उसको कफहरी करके बोलते हैं। तो दिया जाता तो वो एक तरीका होता है। और कफकुटार रस को बहेड़ा चूर्ण में देने से वैसा भी एक्सपेक्टेशन होता है। और इसके साथ जो है ना इन्फ्लेमेशन का जो कम करने का तरीका अभी जो डिस्कस कर रहे थे, वो जो धूम्रपान वो सब सिस्टम से वो कर सकते हैं। लेकिन यहाँ इतना सेफली जब इलाज होता है, इतना सेफली जो है ना एक्सपेक्टेशन कर सकते हैं, और साथ साथ अपने पास तो अभी तो भारत में इतनी सहूलियत है, दिमाग वैद्य की चुनने का जरूरत है। दवाएं काफी है, यहाँ कोई रोक टोक नहीं है करके नॉनसेंसिकल ऐसा कोई इधर उधर चुनने का जरूरत नहीं है। रेलेवेंट प्रिस्क्रिप्शन दे सकते हैं। इसका प्रकृति के इसका भस्म प्रकरण में ऐसा कॉम्बिनेशन में था ना, मामूल में जब इलाज होने के बाद रिकूप करने के मैंने रिअकरेंस नहीं होने के लिए अब्रक भस्म लेकर के पिपली चूर्ण 64 टिप्राहरी पिपली चूर्ण के साथ दिया, तो वो जो है ना आसानी से जो है ना उसका इम्यूनिटी भी बढ़ता है और लंग स्ट्रेंथन भी होता है। तो इतने सहूलियत है आयुर्वेदिक सिस्टम में। हाँ, हम तैरने के लिए नहीं खेल ले सकते हैं, लेकिन प्रॉपर मेडिसिन कहाँ पर कफकुटार उपयोग करना, कफ केसरी कहाँ पर, कफकर्तारी कहाँ पर, श्वास चिंतामणि कहाँ पर और श्वासकुटार कहाँ पर, ये वैद्य का एकदम एक्सपर्टाइज की जरूरत होती है। तो इस सिलसिला में हम लोग कोई ऐसा, मैं तो ये समझता हूँ आयुर्वेदिक सिस्टम में कोई ऐसा नहीं है जो कर नहीं सकता। पूरी तरह से उपयोग करे, ठीक तरीके से जानकारी रखे, क्या नहीं कर सकते। और तो समीर पन्नाग रस के बारे में आगे की बात है, कहाँ पाषाण योग इस्तेमाल करना, ये सब तो अपने माने जानकारी अपने एक्सपीरियंस से कर सकते हैं। धन्यवाद।
थैंक यू दोमा जी, वेरी अमेजिंग, थैंक यू वेरी मच। दोमा जी एक बार और बताना जी, वो आंध्रा वाला किताब आपने जो बताया,
आंध्र भैषज रत्नावली।
आंध्र भैषज, थैंक यू वेरी मच। I found, thank you very much. Chalo, Pawan ji, this has been every minute has been educational. Every minute.
मैं रसशास्त्र का स्टूडेंट हूँ सर। आंध्र भेषज रत्नावली मैंने आज सुना है रिटायरमेंट के बाद।
वास्तव में पवन जी वो तो बहुत पुराने काल से है, पुराने नूरी रामशास्त्र कॉलेज के जब से है आंध्र भेषज।
बहुत अच्छा सर। कहीं पढ़ा भी होगा टेक्स्ट में तो उतना इम्पोर्टेंस नहीं दिया, लेकिन ये चीजें सीखने की है सर, हम लोगों के लिए सीखने की है।
दूसरा भी है जो बसवराजियम करके आप सुने होंगे।
बसवराजियम सुना है।
बसवराजियम का एक ही एक दवा जो शीतांशु रस एक ही कोरोना में रूल कर सकता है, जिसे मैं ट्रायल भी किया हूं। आज रिवील कर रहा हूं द प्राइम मेडिसिन इज शीतांशु रस। यू गो द कॉम्बिनेशन ऑफ शीतांशु रस, इट इज विद हरताल के साथ होता है और त्रिकट का उसके कॉम्बिनेशन में होता है, लेकिन प्राइम मेडिसिन होता है उसमें हरताल। और एक मामूली शीतांशु रस लेकर के जो पूरा अपन चाहे वो गिलोय घनवटी देने का वो सब बार की बात, लेकिन द प्राइम मेडिसिन विल बी शीतांशु रस इन कोरोना। टुडे आई एम रिवीलिंग which I tried on all of my patients and even those who are under me, विलेज प्रैक्टिस करने वालों को, वो लोगों को भी दे दिया, क्योंकि सरकार का ये रूल था ना कि कोरोना का कोई भी पेशेंट आए पहले सरकारी दवाखाने में जाकर के उसको कंसल्ट करना, अपन डायरेक्टली डील नहीं करना। क्योंकि केरला से भी एक मैडम ने बोली थी कि ये मना करे थे आयुर्वेदिक डिपार्टमेंट वालों से। आज ये जगह जंडू खुद तैयार करता है शीतांशु रस। बसवराज योगम है, वो बसवराज योगम है जिसका उसमें एक प्राइम मेडिसिन होता है हरताल का नाम लेते ही अपने वैद्य लोग जो हिचकाते हैं। उसमें वर्ग के हरताल।
बहुत बढ़िया जी, थैंक यू। We have so much to learn from each other, you know, Pavan ji. इतनी so much knowledge, practical knowledge, insight. कहीं होम्योपैथी, कहीं सिद्ध वाले, कहीं अब आंध्र से कमाल की किताब, केरल से सहस्र योगम, उसके अंदर भी पढ़ा कुछ। अब महाराष्ट्र से ये देखो चिकित्सा प्रदीप और अलग अलग चीज। राजस्थान से भी बहुत होंगे, गुजरात से भी बहुत होंगे, पंजाब वालों के पास भी होगा।
मदर जी एक और बात, जो शीतांशु रस होता है ना, वो जो है अंजन भी कर सकते हैं, दो इट इज द प्रिपरेशन ऑफ आर्पिमेंट। उसका योग में लिखा हुआ रहता है, बसवराज योग में लिखा हुआ रहता है। जब कोई अगर ऐसा सन्निपात से पड़ा हुआ रहता है उसको अंजन भी दे सकते हैं। माने आंखों में लगाने का दवा जो आर्पिमेंट से बना है, सो कोई फॉरेन कंट्रीज वाला अंदाजा कर सकता है कि हड़ताल का बनाया सो, और वो भी अंजन, उतना सेफ मेडिसिन। लेकिन कभी प्रस्ताव नहीं हुआ, कभी नेशनल लेवल में इसका उपयोग नहीं हुआ और पॉपुलरली उसके बारे में बात भी नहीं करे। जंडू वाले ने फर्स्ट कोरोना टाइम में 2019 में जब वो लोग जो दिए थे 3 स्टेज पर, तो कहाँ पर शमशमनी घटी वो सब देते लास्ट स्टेज, लास्ट लाइन में वो लोग दिए थे शीतांशु रस करके। लेकिन आउट ऑफ द ओनली वन, इवन निजाम टाइम का वैद्य क्यों ना हो, अगर लक्षण कोरोना के बोलते, वो खुद मुख पर बोल देता था कि अरे भैया तुमका इतना बड़ा वैद्य बन करके जान नहीं सकते हैं कि शीतांशु रस से इलाज कर सकते हैं। इतना आसानी है जानकारी के लिए, जो जानते हैं, न जाने को क्या बोल सकते हैं।
Well, Doma ji, इतनी specialization है, this is not for the common man. आपने जो बताया, this is specialist. This is the power of this specialized knowledge, you know. This is, and it is only for that level of expertise, you know. Harish ji will keep saying that all these special devices must be manufactured, number one. दूसरी चीज, they cannot be prescription, they must be only, they cannot be over the counter, they have to be prescription only drugs. So this is it's very, very important that we discuss this point. आपने जो उठाया थी ये point, this is a very important point. There are so many wonderful formulations, और उसके अंदर must be for the specialist. आम आदमी के लिए नहीं, it must be for the specialist, and we must point this out, that there are wonderful formulations. They are not being manufactured. They should be manufactured. There must be quality control for this, or they must be only, they must become prescription only drugs. Harish ji ke man mein काफी कुछ है इसके ऊपर, how to, with a small modification of our regulations, how we can develop this ये जो prescription only drugs. I think it's Schedule X or something. There is one aspect of our cosmetics and the regulations where the Schedule X, where we can start to demand for prescription only drugs. Chalo, Pawanji, Domaji, you are always inspiring us with listening to us carefully, and as I said earlier, always giving us something new, surprise at the very end when you come to share in the platform. We are very grateful that you are here with us, guiding us and showing us the correct path. Thank you, Ji. I have just located हमारी एक digital archive में शीतांशु रस के बारे में थोड़ा सा है, इसमें some things are there which I am just looking through.
Directly it can be consulted with Basavarajiyam. It's a voluminous book available. Basavarajiyam.
Chalo, this is, I can see antipyretic study of Shitamshu Ras and its modified methods. Badhiya ji. Pavanji, with your permission, we could draw this event to a close.
Sir, कवि सम्मेलन के बारे में एक कहावत है, एक जोक सुनाने की इजाजत है।
बिल्कुल जी, बिल्कुल।
चार कवि मिलके कवि सम्मेलन कर रहे थे और सामने बैठे लोग वाह 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 कर रहे थे। आखिरी में 5-6 लोग ऐसे रहे जो कंटिन्यूअस वाह वाह करते रहे। सुबह के 3-3:30 बज गए। तो कवियों ने पूछा, भाई सब पब्लिक चली गई, आप लोग क्यों नहीं गए? उन्होंने कहा, हम सब टेंट उठाने वाले।
Beautiful, beautiful.
So, अरे लगता है अग्निहोत्री जी पहुंच गया होटल। अग्निहोत्री जी नमस्कार जी, आप कहाँ हॉस्टल या होटल पहुंच गया जी लगता है? टेंट उठाने वाले
वो तो तभी लोग जब हटेंगे तभी टेंट उठा पाएंगे, इसलिए वो वाह वाह।
गुड नाइट पवन जी, बढ़िया। अग्निहोत्री जी गुड नाइट, शुभ रात्रि। दोमा जी शुभ रात्रि। रामपाल जी शुभ रात्रि। गुड नाइट जी, गुड नाइट।